Dennis, how are you, mate?
Very good, Chris. Yourself?
Yes, it's amazing to be, or delightful, I should say, to be talking to Australia. I'm going to be honest, maybe I should have read your LinkedIn profile more, but I didn't realize you're an Irishman down there in Australia.
Yeah, I thought the name might give it away, the O'Connor part of it, but yeah, all good.
Yeah, I don't, how did it work then back in the day? Because I know England sent their convicts to Australia. Was that the same for Ireland, or is my history just bad?
No, the history is good. Some people might suggest that I was sent there for those reasons, but I'm denying everything. But yeah, there certainly is a fairly decent founding population where a few people didn't do the right thing in Ireland. They got shipped over here.
Okay, but that's not obviously not your family because you're what are you an expat, I suppose you'd say.
Yeah, I guess I would be now. Yeah, I feel very Irish, but I hit me a few years back, but I've actually been here now longer than I've lived. So in other words, I didn't live in Ireland for as long as I've lived here, and that I don't know how I feel about that.
That I like I like that. There was a time in my life, my adult life, where I'd lived more of my adult life in other countries than I had in the UK. I was perfectly happy about that. In no
That's
disrespect
interesting.
to the wonderful people of the UK, but I like you experiences, you can't regret experiences, right? And that's what travel has been for me. um
Definitely.
so for the benefit of our friends at home, hello, welcome to another edition of the Bought the T-Shirt podcast. It's my great delight today to talk to Dennis O'Connor. Dennis very kindly started supporting my podcasts, my work, etc., through the LinkedIn platform. And when I read Dennis's profile, I found that he's not just a delightful, kind and generous man, but also we share a lot of a sort of similar interest in mental health. I'm guessing our knowledge base probably, crosses over quite a lot, Dennis. And as such, especially in this climate now of veteran suicide, of male depression, I say male, obviously it's female as well, but for some reason, 70% more of it at this moment in time seems to be with the guys. But before we come on to that, Dennis, what's it like to be a scuba diving instructor down there in Cairns?
Fairly awesome, to be honest. And Cairns, I'm not sure how many people know the geography, but Australia is fairly big. It's about the size of America, the mainland America. So I'm right up near the top, and there's a massive difference geographically between normal Australia and up near the top. So I'm in the tropics. So where I am is the gateway to the Barrier Reef, and I did my diving training there, and it's just incredible stuff. You kind of see all sorts of uh, amazing fish and have some fairly hairy experiences sometimes. But to kind of, I guess, put into perspective, I'm probably one of the worst instructors out there. I basically did that to just, reach a certain pinnacle with diving. So I never really did it full time as a job, but, still amazing experiences, lots of dives under my belt. So yeah, I can't complain.
Yeah, I made it down there. I hired a car in Sydney, ripped the back seats out of it, not literally, but took the back seats out and left them with a mate there in the suburbs, and bought a surfboard in Newcastle and a very thin wetsuit. And then I just drove up the East Coast, putting the tent up each night, at all the kind of probably a bit cliche backpacker stops, but that's what I did. And got up, didn't quite get as far as Cairns. What's the place just below? Is it Airlie Beach?
Yeah,
Is
Early is
that a
beautiful.
famous?
Very famous, and it's basically one of the entries to a thing called the Whitsundays. So it's got all these tiny little islands, which and some of these islands are just incredible. They've got like sand, like powder, and you think movies don't even portray how beautiful it is.
Yeah, we got up as far as there, me and the girl I was traveling with, and we went out to the reef, it was a real eye-opener for me as a scuba diver, because I did my basic course in the military. So I did the British Subaqua Club course, the BSAC, I think it's called. Very strict and very comprehensive course. So you actually do rescue diver as part of your basic, right? I then did my advanced scuba diver course in Central America, in the Caribbean. I think it was off Nicaragua. And I did that with Paddy. So immediately there's a step down in,
yes,
I'm not going to say standards, that's not fair, but there's a step down in the level of understanding you need. The way it was explained to me, and no offense meant to anyone, but Paddy is for rich Americans, you know, to understand on their 2 weeks holiday a year or something. I'm just saying what I was told. But what I'm coming back to is, we got on one of these big sort of cruising boats in Airlie Beach. I say cruiser, you know, a dive boat, but it was a really big dive boat, bigger than I'd ever been on before. Had a big deck at the back where you could actually kit up inside the boat, made your way out to the deck, and then the diving instructor, or the guy overseeing the dive, went, "All right, come on then, guys, get in, come on in." And I turned to my friend and went, this ain't right. You don't hurry divers to get in the water. They take their time, get their equipment check in order. When they're happy, they're comfortable, you know, all good, right, you know, and off you do the old roll backwards or jump forwards off the boat. So that was, I found that really out of order. And then also, of course, these dive spots they all kind of looked dead. All the coral looked really dead. And that's, in fairness to Australia, that's the same in all the dive spots I've been in the world, with the exception of Belize, which is just, it's two different worlds, Dennis. In Belize, you're actually diving in national parks that have been preserved from fishing and all this kind of stuff. All the coral hasn't been stamped on by 5,000 scuba divers a month. Sorry, I'm aware I'm talking in your podcast, but I just want to say that, yeah, I've been down there from Airlie Beach. We dived on the reef, and it was a bit of an eye opener.
Yeah, listen, I'm hearing what you're saying. You know, Paddy are a little bit commercial, unfortunately, and yeah, there's a lot of traffic at the main dive sites. So, but I've been lucky enough to know a few people with boats, and I've seen some pristine Australian reef and just amazing dive sites and loads of really interesting creatures as well. So I've kind of got to see the little jewels in Australia.
We were there too, just after that American Cup. The American couple went missing. They made a film about it. I can't remember the name. It was called I think they called it Adrift, even though that's a bit of a confusing name for a dive film. But the legend that we had to hear when we arrived there was that they had gone diving off one of these boats, just like I said, and that the boat, everyone else, all the divers had come up except these two Americans, got back on the boat, and the boat went back to Australia without them, so back to Cairns or Airlie Beach, and these divers popped up, and of course they're 40 miles out to sea or something, and there's nothing. And then the thing was that they'd found their chalkboard, their divers kind of memo board, and it said, "We've been left on the reef. The tiger sharks are coming in. We haven't got long now." And that washed up in a creek somewhere back home, you know, somewhere on the continent. And it all sounded terrifying. But then when someone made the suggestion of insurance fraud, and that they had gone diving off that boat, swum to another boat, and disappeared, purposely leaving, purposely leaving this chalkboard, in a creek in America, because the chances of that happening are really slim, right? And someone finding it and realizing it was this couple, then that seemed more plausible. Did you hear anything about that?
You've just educated me. I heard about the couple, but I didn't hear enough about the insurance part of it. That's fascinating. And, again, stranger things have happened.
Yes. I had two diving experiences, very, very different. One was the wetsuit diving, which I found really easy, and I was kind of, the Evel Knievel underwater, or at least that's how I felt. Never had an issue with it. Then when I went to Antarctica, I had to retrain in a dry suit. The buoyancy, because in a dry suit, it's air that's keeping you warm as opposed to water trapped beneath the suit. The buoyancy challenges that created really gave me a problem. And you can't get diving wrong. If you get it wrong, you can very easily get dead, right?
Yes.
What was happening is I was trying to put more, I didn't pick a buoyancy source. I should have picked either the suit or the jacket, the inflatable jacket that you wear, right? BCD, buoyancy control device. I believe the best way to dry suit dive is just use the dry suit. And so I was mixing between the two constantly. And what happened is I would get out of control. And of course, as you go up 5 meters, the air in your suit increases exponentially because of the pressure. So you shoot up even faster. And you get in a situation where no matter how quick you're dumping the air out of your valves or your
behind the
control, you can't get back. And twice I rocketed out the top of the ocean, and we're talking from, 30 meters down. Luckily, obviously I made sure to get back down there as quick as possible, so I didn't get the bends, but very frightening stuff. One time it happened in a quarry, and I perforated my eardrum because I just rocketed up so fast, the pressure burst my eardrum. And it wasn't until I actually almost left to go to Antarctica that I started to just feel confident. But before that, I had one awful incident where we were down diving on a wall here in Plymouth. We'd gone in at high tide a little bit too late. And as we ended the dive and came back around this wall, and it was only about 20 meters, the current was rushing past. And it's okay. There was enough to hold on to seaweed and, on this wall to stop getting dragged out to sea. But for some reason, I started to have a panic attack, something you mustn't have underwater. Vital you don't have one. Something I never thought I would have. Something that is just a product of probably years of what I put, my mental state up and down through. So we started off that dive. I pulled out my diving knife and I rescued this lobster that was caught in fishing gear, right? The lobster scurried away, and I thought, that's a nice divey thing to do. Went to put the knife back. I couldn't get it to click in the holster. And the next thing I looked, it slipped out and gone. I think that kind of put me on a dodgy wicket from the start of the dive. Luckily, coming back up, I'm tapping my dive buddy going, and this might sound weird, it goes against everything we know about decompression, is you don't go up quick, you go up in stages. You get that nitrogen out of your blood so it doesn't bubble and kill, cause an aneurysm in your brain and kill you, right? You don't go up fast. Ironically, I'm looking for him to go, let's go up, which he wouldn't have done because he's got years of experience. But I'm looking for any sign. Dennis, I just wanted to get out of the water. It was terrifying. Yeah, I think I'm fair to say it was it was terrifying. When we luckily he went like that. Just him doing that made me sort of calm down and hang on in there. And he's checking his dive computer. And I'm like, oh, please, let's just get out of there. And he checked him fine. He's like, yeah. And I'm like, oh, God. And when we got out, I didn't even actually tell him the level to which that had affected me, right? Do you have any kind of similar, you must have had similar, not maybe you personally, but with other divers being an instructor?
Yeah, I've got a few that spring to mind, but one was when I was doing my I think it was I was doing my advanced or later than that, and it was a beautiful place I've dived, but I hadn't dived in the night before, and I was fairly excited just going on a night dive. And there was a few people, I think it was about 6 of us going on to sign off on one of these kind of skills that we had to do. And again, it's just, you know, it's almost like the Swiss cheese, isn't it? Where a disaster is all this perfect scenario of all these holes lining up, and then you get your disaster at the end of it. And for whatever reason, it just didn't sink in at all, because I was one of the more, apart from the course director, I was probably the most senior diver. And he said to me as we're getting the tanks out the car, Dennis, I'll give you this one, because it's just a half a tank, but there'll be plenty for the dive. You can see where this is going, yeah? And yeah, no worries, yeah, totally, you know, fine, etc., etc. And with this, when we were having this dive, one of the other guys was a little bit less competent, but he kept on, and this, we were diving this in this volcanic lake. So this lake is probably 100 plus meters. It's fairly deep. So obviously, as you know, you recommended kind of limit is around that 20 to 30 meter mark. So because we had kind of more junior people were staying around that 20 meter mark, but one of the guys kept on peeling off down the incline into this water. So I'm kind of chasing this guy and trying to drag him up. So I'm using a little bit more oxygen. And after about, 10 minutes of kind of supervising this guy, you can guess what?
You run out of air.
Yep. So, yeah, and you got to get 20 meters, and you don't have anything left. This guy had kind of drifted off again, and I didn't have air to get him. And I looked at again, really lucky situation. But one of the other guys was kind of fairly close, and he was quite a senior diver, well-experienced diver, and I had to grab him by the shoulder, and he kind of looked around at me, and I'm trying to make this sign, which is no air, and he wasn't quite getting what I was saying. I was like, fuck, what can I do here? And I couldn't see his reserve because it was dark, and you know, it's all, again, the perfect holes in the scenario.
You mean like his spare mouthpiece? You can't.
That's what I couldn't see where this thing is, because we've got these lights beaming, and I'm looking around, and I'm kind of trying to control my panic. And I'm tapping his regulator in his mouth, and he's kind of looking at me blankly, and I'm going, fuck, this is, I got 20 meters to go here.
Any diver with even kind of basic experience would have known that you needed to share your air, you know?
The perfect scenario where it was dark, my light was probably in his face, he was looking around, what's going on, you know. Again, there's a lot of different reasons, and unfortunately, I kind of cringe when I think about this, but I had to grab his regulator at kind of around the 30 meter mark and take it from his mouth and chuck it in mine. And his face was one of shock, and I'm body breathing. We got back to the top. Very, very lucky that he didn't panic. He recognized what I was doing, and I'm very lucky that, you know, that could have been an absolute disaster. So I'm still good mates with that guy, and we didn't know each other well at the time, but that's a good way to bond.
I was 20 meters down in Antarctica, diving on a wall, so a rocky wall basically, and I started breathing in to my lungs seawater.
Oh.
And yet I still had the regulator between my teeth. Okay. I went wasn't a regulator. It was just the mouthpiece.
The mouthpiece, yes.
The cold water was so cold down there, it had shattered the little plastic tie that held the rubber teat that you bite to the actual air supply. It shattered, the air had dropped off, and I've just got this rubber ring in my mouth, and I'm trying to breathe because I think I've got the air in my mouth, and I'm going and it wasn't until I went like that, and we're talking, this is in split seconds, I went, that I realized that my regulator had somehow shattered in the cold. I stayed calm, and I reached for my emergency octopus, which was here. And I remember thinking, in the 3 seconds or whatever it took to locate it, put it from its clip, put it in my mouth, thinking, this better work. Right? Because at the same time, my mind's going, this might be broken too. And if that happened, I got to get to my dive buddy over there, Lynn, who fortunately was only about 3 meters away. And I went, thank God for that. But the very first thing I did, because I recognized that I'm obviously kind of in shock now, you know, to a degree, is I just tapped Lynn and went, and immediately he didn't question it. He knew something was wrong and we needed to go up. We went up, and the inflatable came over and picked us up. But we actually lost, I say lost as in killed, one of our dive buddies. In fact, the girl that was opposite me in the boat, in the rubber dinghy when we were putting our kit on, that girl there drowned on a very first dive.
Oh, dear.
I won't talk about it now. I think I talked about it on my last podcast with Sean Atwood.
Yeah.
It's a tragic, but if you're not all about with all your drills and all your understanding, you can even be nervous, that's fine. But if you're nervous, but you know the drill to do, should anything occur, then an accident can, and it's not the kit, it's not the equipment, it's not the scenario, it's the way your brain cannot react under that pressure, right? You know,
Absolutely.
or you've let yourself get in. Like, have you seen that? You know, they got a blue hole in Belize, which I've dived on, right?
I think I've heard about that. Yeah, it's incredible. Yeah.
But there's one in Egypt, isn't there? And it's caused quite a few deaths because people tried to swim down or dive down through this archway, not realizing the archway is below 40 meters, which is your absolute maximum as a sports diver. When they get down there, they air at pressure is so small that you're breathing lots more of it. So you're emptying your tank at like 10 times the speed, and they get down and they realize they don't have enough to get air to breathe to get back up or to inflate the jacket because it's under so much pressure. And so rather than go up, they start plummeting and they panic. And before you know it, they're on a journey down to the bottom of this hole, and it's at least 100 meters down. And one guy, it's on YouTube, his camera was on the whole way down. It's one of the most chilling pieces of video I think I've ever watched, because you know, as a diver, you can put yourself in that position and you know he's on his way to his death.
And you'd see the colors changing as well from the spectrum as you're going through the water. That would be very haunting. Another one that springs to mind, and one of my colleagues had the unfortunate experience of being around on this day. But you know, we're in the Great Barrier Reef. It's in Cairns. It's like the kind of, I guess, the cattle market of these people kind of constantly coming in through the water, and you have a lot of dive masters who are learning how to be dive instructors. So they're working for kind of a lot less money, and they kind of stay on boats, but there's a great camaraderie at times. But you have kind of, I guess, maybe some younger people and not some great experience at times. And this was about, I feel like saying 10 years ago now, but I think it was about 6 or 7 years ago since I was kind of talking to these guys. So it maybe 15 or so years ago, but it's a really quite infamous story in Cairns where there was a famous little haunt with a beautiful but very, very big moray eel. And they very friendly as well. You know, people could put their hands underneath him, he'd come out, they'd feed him, etc., etc. But somebody, one of the guy divers, had the idea to prank this dive master girl, so he put some fish in her dive suit. Okay, and the consequences of that ended up actually being quite horrific. She went down to show the dive tour the moray and do the normal thing that they were doing. And the eel sensed it was feeding time and started savaging her arm. So obviously she had to come up and kind of be rescued. But unfortunately, the actual traumatic injury wasn't so bad, but it was the infection in the eel's teeth that meant that she had to have that arm amputated. She had a nasty infection and lost her arm. And this is a young girl, you know, early 20s, etc., etc. Just for, you know, you can imagine how not only she felt, but the guy who just thought he was doing this kind of innocuous prank would have felt as well. But it just goes to show that you know, there's some things that you can't account for, you know.
It's a similar thing with situations that happen in the military. And what I mean by that is, if there's one place you don't fuck around, it's scuba diving in any way. There's no such thing that, you know, I'm sure I'm talking to the choir here, preaching to the choir, but and to this, you know, to the same end, in the military, there's this trick you can do. There's a thing, let's call it a thing you can do. If you've got your 9mm pistol, so I carried a 9mm for about a year and a half when I was on when I worked on ship. That was my personal weapon. Used to literally, I know it's cliche, but used to sleep with it under my pillow, not because I thought I might have to shoot someone in the middle of the night, but I was too afraid of bloody leaving it somewhere and then getting on a charge with the captain of the boat, right? But there's this trick where you point it at someone, and unbeknown to them, you click the magazine catch with your finger. So it's called dropping the magazine. It's the catch you push to take the magazine off the weapon. And when you're pointing at someone and you click it, they can't see you do that, right? So they don't know you've dropped the magazine. And then you point, you cock the weapon, and to all intents and purposes, it looks like they've just chambered around, and then they pull the trigger, right? But of course, because the magazine's dropped, it hasn't picked up that round, and the chamber's empty. Now, to anyone listening, please don't ever do this. It's the most stupid thing I think I ever heard. And you hear some stupid things in 7 years in the British military, right? And I'm not even sure what would possess someone to do it, other than sheer, like I think this dive guy, sheer naivety, and just naivety. It's not malice, and it's not stupidity. It's naivety, and not predicting what the consequences could possibly be. And so we had a situation where one of the guys, I'm saying no names or scenario here for obvious reasons, but one of the guys pointed his weapon at someone. He'd said something about his missus, and he went, "You don't say that about my missus, I'll show you." And he did that. He clicked the button, cocked the weapon, but the magazine had stuck. So technically it was disengaged, but it hadn't dropped low enough for the round not to be away from the there's a name for the chute thing that picks it up. Mm-hmm. But anyway, so he's effectively pointed at the guy, cocked his weapon, and it's live. Oof. And then he pulls the trigger. Oh. And he shoots the guy in the leg, fortunately in the leg. Again, all my dits, as we call them in the military, or stories, I'm telling you what I heard. I'm not saying this is the God's honest truth. So anyone who also knows this story, feel free to get in touch, but like don't shoot the messenger. But anyway, they got the guy in the ambulance, and his mate had the knowledge to put his knee in the wound, and it's the exit wound, obviously, that you're putting you're blocking, because he'd nicked the femoral artery, I think it was.
Yep.
And his guy in the ambulance just put his knee in the hole and just stayed there, keeping the pressure on, and kept this guy alive. That's a bit of a fucker to have that reputation in the Marines, because you're forever going to be the guy that shot someone, and he's always going to refer to you as, yeah, remember that time you shot me?
For some reason, another one, which is a digression a little bit, but another haunting one comes to mind. And it was when I was working in intensive care. And it's a little bit off topic, but it's in that kind of, spectrum of stuff that makes you think about life and death as well, obviously. But we got this this youngish guy in. I think he would have been about early 20s around that stage. And again, it relates to mental health. Back to that. But he basically was a it's called paraquat, which is a weed killer. It's kind of poison. Paraquat ingestion, and this is quite a while ago now. This is late 90s. But at that time, maybe things are more sophisticated now, but at that time there was a urine test that you do, and if the urine test came back green, that meant that sufficient poison had gone through your system, and the mortality rate once that test was positive was literally 100%. And ironically, what you have is you have this burning of your respiratory tract, of your esophagus, from where you initially ingested, and that can heal up a little bit. And your mortality usually happens within from memory, for a 3 to 4 day period. So we have this situation where when you have a ventilator, and it's called an intubation, and when you pull that tube out, it's called an extubation. So exit of a tube, basically. And when you extubate somebody, they're usually conscious, and because they can support their own breathing. So I had this really bizarre situation of having to be, I was the person looking after this guy on extubation when he woke up. So I had this guy waking up fully conscious, asking me what was going on, and I've got to break the news to him that he's going to be dead in 3 days. So the conversation went a little bit like, oh, where am I? What have I done? Do you know where you are? Yeah, I'm in hospital. Can you remember what happened? And after a little while, he kind of agreed that he said, yeah, I remember what happened. I kind of took something. How do you feel now? I guess I'm glad to be alive. I probably didn't really mean it. Yeah, I was really distressed, blah, blah, blah. What's going to happen? Oh yeah, what's going to happen? So, and I'm kind of, yeah, I wouldn't say a very senior nurse at the time. So I mean, I kind of, so this would have been maybe mid-20s myself. And I'm kind of faced with this scenario of saying, listen, man, I gotta be honest with you, but this poison, it's something that goes through your system, and people don't recover from this. And he's looking at me. So
basically, like, the worst is yet to come for him. It's
oh yeah,
the worst is yet to come. It's he's a ticking time bomb, basically.
So he's kind of saying, what does that mean? I'm going to die? And I said, unfortunately, I think that you are. And then he's asked me another really haunting question. And because you're looking after certain clients, you gotta, you read up about their conditions. And he said, what's going to happen? And I found myself in this almost surreal situation of explaining to him that he'd be released from intensive care soon, and he'd go to a ward, which would be a ward where his life was probably going to end there, and his lungs would slowly fill up with fluid, and he'd be given pain relief to help him through that, and then he'd pass away.
Jeez. God, it's how did he take that news?
Very surreal. He took no tears. He basically just looked at me and said, okay, thanks for that. And it was almost like this weird compassion that he had for me, because I had to explain that to him. And after that, you don't make conversation. That there's just this, I don't know, calmness. And I guess he would have gone through, so then about 6 hours later, we took him to the ward, and he died a few days later. So I don't know what he would have gone through during that little progression.
Gosh, yeah, it's all well and it's all well and good being philosophical about death and, spiritual but when you actually hear that news that it's your time,
yeah,
it's another thing again, isn't it?
Indeed.
I mean, just you telling that story, I feel like a chill comes over me as I imagine I'm that person just thinking, wow, I'm alive. And it's on a more humorous note, in the way that the Marines would have dealt with that, is they'd say, right, hands up, who's happy to be alive? And they go, what's your hand up for? It's it's that morbid
gallows humor.
Yeah, it's more, to be honest, I'm probably exaggerating a bit. It's more done for when you're in training in the Marines. Every sort of, at some point during the day, usually late afternoon, you're called out onto the balcony, the stairs, because you're all on like different floors in this building. You're all called out and you gaggle on the stairs, and then your troop commander or your sergeant or your officer or corporal will read some orders to you or tell you what's happening tomorrow, whatever. It's also the time they give out the mail from home, and some weird things would go on. First of all, it seemed apparent your training team, these NCO, they were allowed to just open your letters.
What?
Well, because they would open them to see if there are any nude photos of your girlfriend in there, and you didn't question this. You didn't say like, that's private. I mean, it's just the done thing, right? Or they'd say, right, come on, who's got any nudie photos? Put them up on the board. And if you had any, you had to put them on the board so that everybody could see, So who said communism is dead? That was one thing. The other thing they do is they'd say, right, and they do just what I said. They say, right, hands up, who's got a grandma called Nora? And of course, one recruit's there going, that's Corporal. No. He'd go. And the corporal would say, Smith, what's your hand up for? Meaning we've just had the news that your grandmother's died. It was, I'm going to be honest, in the Marines' defense, I never saw that myself. And I think it's probably more of an in-house joke. They weren't that insensitive, right? But
as I guess, to continue on a slightly humorous one, to change the tone from the last intensive care story I had. But during changeover, you have all the dangerous drugs locked up, okay? And you have to count at the end between every shift. So it's really important that you keep those keys. So one of the places I worked, the keys had this long red rope, so you'd kind of easily find them and you couldn't really get lost, okay? And one of the guys who was training with, a guy called Peter, and he's probably around somewhere. Interesting story, really fit guy, good-looking guy. I was always jealous of him because all the girls loved him, okay? But he ended up joining the most elite army corps in Australia, which nobody gets into. Even I think they recruit about 5 people every year. This guy ended up passing these ridiculous tests. He used to run marathons. Really interesting guy. But to cut a long story short, one of the guys who I was looking after, and again, it goes back to mental health all the time, was a post-hanging. But he actually didn't do a very good job, and he was doing okay. But his family were sitting with him at the time, so he was asleep. Peter didn't have the handover, and we used to mess around and have a bit of a banter. So I'm sitting at this bed. You can just imagine it. The bed's in front of me. The 2 family members are kind of sitting with their loved one. And Peter walks up behind me with this long red rope, and he pretends to wrap it around my neck and pull it. His family members who are looking at this guy who's just tried to complete hanging are looking at Peter with a rope around my neck. And I'm kind of going, no, not now, please.
My
And
God.
I kind of had to chuckle and I can do a pretend, I'm so sorry. And Peter just walked away oblivious. I told him afterwards. He was pretty embarrassed.
I was a mental health nurse for a few years. I worked on the bank, you know, so I was like the guy they call if they need someone to go to this hospital or this ward.
Yeah.
And one day I got called to this hospital and I'm there and they didn't actually tell me when they sent me there. It's acute, what in the old days they'd call an acute psychiatric ward. So these days, I don't know what the equivalent is, but it's, no, they'd call it a secure mental health facility, right? Just a bit of difference in terminology there. And the majority of the men in there, I think it was male only, had killed their partners. And then I mean, I'm not saying they weren't genuine, but their defense in court was I was mentally ill. As such, they were, they were sort of sectioned to this facility. And I'm sat there on my first day. The guy, I hate using the word patience. It's so medical and wank and inhuman. As a drug worker or a youth worker, as a youth worker, you say one of our young people, which is as a drug worker, you say client, much nicer, much more respectful term. But anyway, hospital terms, a patient comes and sits next to me. We got chatting and we were having a perfectly ordinary, interesting conversation. And then he turned to me in the next breath and said, yeah, well, President so-and-so, Bush, Bush is coming to Plymouth and I'm going to ask him about the problem, the situation in Devonport Dockyard. Devonport's the dockyard we have here in Plymouth. And at that moment, I realized he's having a moment, right? You know, a psychotic thought, psychosis, whatever the correct term is. So that at that point, then you start going into not so much humoring, but, trying to take it with a pinch of salt, trying to put it back that, are you sure about this? This sounds like, this is a delusion. They used to say, be honest with the person, right? Don't try and play along with it and go, oh yeah, you're an angel, brilliant. Because again, one of these situations, I don't think there's one way of approaching it, and I don't think there's any simple answer. But the next thing I knew, he disappeared off to a different part of this unit, and I suddenly heard this shout say, "Look, Chris, I'm having a wank." And I looked around and there's this guy, wasn't naked, but he's standing, some distance away from me in this unit going, "Look, Chris, I'm having a wank." Well, obviously I felt for him, this guy, the horrible thing about, one of the horrible things about mental illness is obviously you have these moments and then you can come back and be perfectly lucid. And then you've got to reflect that, oh my God, I just had that moment, right? This is a terribly tragic story, I should warn you. So one of the other nurses that had been there obviously longer than I had took this guy under her wing and she shut these sliding doors to keep this guy away from me. Another nurse came up and said, "Chris, no, that was it." The nurse came up to me and said, "Chris, are you all right?" And I said, "Yeah, I'm fine. Yeah, no problem. My first day." She went, "No, I mean about that." And I'm like, what about that? And then I turned and it was this guy having the moment. And then he upped his volume to really get my attention, which he's got now anyway, because this nurse has just informed me. And he's going, I'm having a wank, Chris, look. And they'd shut these sliding doors, these two plate glass doors, to keep the volume away from the lounge area and to keep this guy away from me, I suppose. And there wasn't much I could do. And because he couldn't come through these doors, he ran at this plate glass window, and he just ran full speed and bang. You know, we're talking reinforced glass here, and he smashed through both layers of it with his head. It was awful. Anyway, fast forward to my next shift. I rock up at this unit, and as you say, you have the briefing before you go on the shift. You discuss medication, where Mr. Jones is, where, or you don't call him Mr., but you know, where Tom is, where Sid's, how's Sid been doing, all this stuff. He got to this guy's name, and I looked at the board and went, where's John? And the staff went, John took the train, Chris. I was like, oh, right, what, gone to see his family? You know, I thought the guy got day release, you know, which some of these, you know, despite the crimes they'd been convicted for, some of them still got released with a worker or whatever it might be. So I thought, oh, he's gone to see his family or something. And they went, no, it's kind of a euphemism we use around. Then I got it. They're trying to say the guy's committed suicide, right? I don't know if he actually threw himself under a train, but that's where the euphemism comes from. Yeah, another delightful story to spice up our podcast.
You just triggered so many more, but we'd be here all night if I started some of the stories I have about acute psychiatric care.
Yes.
Oh, well.
Yeah. Right, let's... do you want to tell us how did you end up down under?
Yeah, listen, like a lot of the best of us, I met a woman I left Ireland when I was about 17 and a half, and I went to England to study nursing. And so I was in London.
You've been to England and you've met a woman. You can see where you're going wrong in life, can't you?
Absolutely. So she happened to be from Australia. She was just studying in England. So because her study was finishing, I just decided, yeah, why not head to Australia and see what happens. So that led to, you know, a much longer adventure of me staying here since then.
And you studied nursing down there or back here?
I studied nursing back in England, and then I did about a year postgrad in there as well. So I was kind of in a bit of an acute setting where you see mostly in medical. So my kind of, I guess, forte, for want of a better word, is that kind of acute, serious health kind of nursing, intensive care, et cetera, which is very interesting, having an overlap with that side of nursing into mental health. And there is a massive overlap, unfortunately, which is mostly ignored. But we can chat about that later, you know?
Yeah.
Yeah.
And it particularly, you know, I felt particularly drawn to you, just for your generosity, Dennis. And I thank you for that, you know. I'm meeting a lot of nice people through this podcast, and it truly is, it's heartwarming to realize there's actually lots of not just nice, kind people out there, but educated ones too, that are aware of some of the kind of hidden issues in society. You have insight into addiction, into depression, into the whole sort of shebang, really.
Yeah, listen, it's fairly fascinating. So I guess I'm really quite privileged to be in the position I am in now. And my understanding, you know, I'd love to say that it was intuitive, or, you know, I had some kind of genius to get it. And that wasn't really the case. It was very, very accidental. So as I mentioned before, probably about 12 years intensive care all up. So that's, you know, turning off machines, seeing people, you know, dying of terrible situations, seeing, you know, picking up the pieces with families, I didn't have a load of experience with kids, which it sounds terrible to say I'm blessed that I didn't, but I certainly did have to. I was involved with when machines were switched off with children, and that's by far the worst of it. Those guys who do that regularly, I take my hat up to them, because I'm when I was doing that, I think I only did it about 3 or 4 times, and I'm a blubbering mess when that happens. It's just
I can't even
visceral thing.
Can't even imagine it, mate. I mean, well, I mean, I
visceral.
kind of can, which is probably as equally as disturbing. Oh, oh.
So again, I don't want to get too here, I guess, poignant with some of the stories, when I could tell a few, but so I kind of, after about 12 years in that kind of setting, you have a lot of personalities that you're working with. So not only are you kind of struggling to I guess, excel at your job, but you're also competing with people. And I had a chat with a really great guy. I did another podcast last week, I mentioned to you before. And he asked me a really great question about kind of the stress involved with that. And we kind of had a chat about you've got to make snap decisions in those settings. And if you, for example, know your way around a ventilator, that's the machine that pushes air in and out for anybody who's interested. And if you see something that's wrong in a crisis, you have to make a split decision. Doesn't matter whether there's a consultant standing there. It doesn't matter how senior the person is. If you're picking something up, you shout and you bark. So unfortunately, you kind of, you don't make enemies per se, but that's, you get this kind of, I guess, ongoing battle that goes on. So what with night duty and that kind of stuff, it actually does wear you down after enough years.
I just chip in my 5 pence worth or cents worth. Oh God, making professional decisions, especially when certain professionals you work with don't deem your profession an actual profession, or even, I mean, I'm a substance misuse specialist, not just, from my private experience, but I've done all the courses to do that as a job. So it's a glorified term for a drug worker. And of course you're working and in that side of the work, it's a social profession. So you're dealing with how people live, how they function in society, how society affects them and supports them, how their family influence ultimately affects whether they end up with a drug problem. This is what I'm trying to say. And of course, where's the medical in that? Well, there's not. You can't biologically be born. I mean, there's a few suggestions about this, but you're not born into addiction. It's an influence of your social circumstances generally. So your nurture as opposed to your nature. And yet, in that profession, they're vying to get recognized by official bodies all the time. So publications, the government, the medical institution. And so they're always trying to be medical, because in the old days, addiction was viewed as a medical condition. And because of that, you're there as someone who knows this subject inside out. I'm not saying me, but as an example, and yet you're with a doctor who, because they've done 5 years at medical school, is deemed to be a god. And that's okay, because you can forge a working relationship, but when they pull rank on you, pull the rug out from under your feet, not just can make you look a right idiot, but it's incredibly stressful environment to work in as well,
Yeah, and there definitely is an overlap. So the situation I was referring to before was that critical care, the intensive care type of situation, where you got somebody who's flatlining and you got to jump on a chest, or you see a setting on a ventilator that this person's getting hypoxic and somebody's not aware of what's going on. You got to call for a crash trolley or something like that. But it does translate exactly to what you're saying as well about this I guess, lack of maybe acknowledgement of some excellent workers because of their perceived lesser position in an area. But, you know, and again, I've told this to a lot of clients and a lot of colleagues. You know, I've been a fairly senior nurse. I've had the privilege to try to teach other nurses and whatnot, and doctors and whatnot as well. But I've said to many people, and I'll continue to say it, that I've found more value in a lot of counselors and people who don't have that, I guess, educational bias, for want of a better word, and who actually can engage in rapport and not jargonize and actually connect with people. So you know, my experience with some counselors are, I think a lot of people who are, if they're struggling with their mental health, will do a lot better often by going to a good counselor. And so sorry if I'm offending anybody out there.
Yeah, no, we just speak our truth, Dennis. What people want to make of it, that's completely up to them. Another of my experiences was the counselor type person.
Yep.
So that all the social work, no, sorry, I'm going to have to go back on social work. but very often the uneducated, you know, the person that hasn't been through the university system can have the life experience, which gives them the empathy, which is so not just the personal experience, but also the empathy. Whereas, you know, what does 5 years in medical school doesn't necessarily give you empathy, and it doesn't necessarily give you experience. It gives you knowledge and a qualification. So, yeah, did I just make sense then? I'm
absolutely 100%. It's really interesting. Hopefully, I'm not going to refer to this other podcast too often, but again, if something really similar did come up. Yeah. And we were talking about the you know, there's some brilliant skills. And one of the gold standards of drug addiction, as you're probably well aware, and drug addiction treatment is this model of a thing called motivational interviewing. Okay, and a part of that is this thing called reflective listening. And I am more or less, I guess, I can actually train motivational interviewing because of something that I did previously. But I certainly, there are peers, I guess, who should be way better, for want of a better word, at this. But one thing that I've always been really good at is just this part of reflective listening. And it's just a dynamic little thing, okay? So I'll give you an example. You get somebody coming in, 45-year-old guy. He's been drinking too much for, I don't know, 5-10 years. His wife's finally had enough. She's left him. He's losing his job. He's at the end of all his money, and the police bring him in because he's threatened to kill himself. And again, this is such a cliche, and I've seen this situation time and time again. He's sitting in front of me, for example, and he's screaming, "I'm going to kill myself. You don't understand." And there's a lot of cursing and swearing and tears. And a really powerful way to I guess address that situation is this reflective listening thing. And you start off with a few words, but the ones I always tell people to use are the 5 words. So what you're saying is, okay? And if you use that often enough, what you're trying to do is you're trying to get the message that this guy is trying to give you. And you can periodically get each message, and then at the end of this you summarize. So the summary might be, okay, let's try and wrap this up. Let's use the name John. Let's try and wrap this up, John. So what you're saying is that you've had a really bad time recently. Your wife has left you. You think she's to blame for a lot of your problems. The boss didn't like you, but it wasn't your fault, but he fired you anyway. You ran out of money. The banks weren't giving you the loan. Everybody's against you. The world's on top of you. You feel absolutely desperate. And when you frame like that, I've literally had people just break down in floods of tears. The weight has just fallen off their shoulders. I've had people jump up. They've given me hugs just for having been heard. Okay. And the guy I was talking to last week said, listen, because he also had his own experiences. He said, and again, I've heard this, he said, there's nothing worse than when you're in that crisis, hearing somebody look at you and go, I know.
Yeah.
You don't need that. But if you, yeah.
Yeah, no, I just wanted just a little chip in there is,
yeah,
it's like when you've got some massive, I say massive because things can kind of spiral to seem massive when they're not. But I'm talking about when you have something in the house, like a domestic bill, one of your services isn't working the way it should, and you end up in this mega frustrated situation with the service, the supplier, yeah. And you get on the phone and you get this person, hello sir, how, you know, I'm June, how may I help you today? And you said, June, it's like this, right? I've got this telephone, I've been trying for ages and blah 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 blah. And she's like, yes, Chris, oh, I get what you're saying, and it's really frustrating. You're like, yeah, it's really, and she says, and I bet you're fed up with it. And yeah, I'm fed up. You know, she's doing exactly what you're saying, right? And the reason I say it's so powerful is when they then go, right, Chris, I'm just going to transfer you. And you're like, oh, I thought you were going to deal with this. I thought you were going to sort my problems out. So, but even on that domestic issue, I'm struggling for the word, but
to use the jargon, you're establishing rapport.
Yeah,
and you're validating.
And when that rapport breaks, as it just did in my example, you go, huh,
high and dry.
You feel like you've just, been dropped.
Yep.
Very powerful.
Absolutely.
Yeah.
Yeah, absolutely. Yeah. But I can't remember where we segued into that, but I think we were talking about that kind of clash. Of course, we're talking about, the effectiveness of counselors. And I've heard these, for want of a better expression, less than perfectly trained counselors do an incredibly better job of this than these people who have got bags of training.
Yeah, very much so. And also the big kind of moral question or what back in my university days, what they'd call the dilemma is to be that empathic listener kind of takes a lot of yourself, especially if you're listening to stuff around child death, or I did a lot of child protection work as a drug worker. I had to sit on the board that decides not just that decides whether the children need to be removed from the parents for their own protection, but and again, this comes back to the medical qualification versus the social qualification. Is I very often, everybody in what we would call the core group, so that's the doctors would never turn up, by the way, because they're all about getting their patients in, for their 6-minute appointments and getting paid their £500,000 a year. And they very often wouldn't even send a report. They'd rely on people like me to get the information from them and take it to the meeting on their behalf. It's wrong. It shouldn't be like that, but they're allowed to get away with it because they're doctors, right? And in this core group, so you should have the doctor, but you've got the substance misuse specialist, you've got the school teachers, probably the headmistress will come because they realize how serious this is. All these kind of professionals who all just want to keep this family together, right? But of course, a lot of it hinges on whether the parents are prepared to make change. And of course, whether the individual, so the mother or the father, is willing to work to address their substance misuse addiction, that dictates how much they care for these children. And that might sound to your rational, average or ordinary loving parent, that might sound abhorrent. What, they don't love their kid? This all becomes a quagmire because they kind of do love their kids, but addiction is a learned psychological mental health condition which takes that power away. And what I'm trying to say is this immense pressure would be piled upon me as the drug worker because everyone's looking at me, and at the same time I'm such a humanist, I will be trying to use my rapport with the client to get them to understand the seriousness. And it really got to the point where I'd be like, mate, in that meeting, they're not going to tell you this because most professionals, I'm sorry to say this, but they're cowards. They are not going to tell you what they've just been talking about. And what they've just been talking about is you're on your last chance. They are going to take your children away from you. And I'm not saying this to upset you or frighten you or scare you. I'm saying it because when that happens, I wanted to have my hand on my heart and say that I gave you the opportunity to work with me. You didn't have to stop your substance use ever. I never asked you. And I've been defending you in this meeting that you should have been in, by the way, but you weren't in it because you were too busy,
Yeah.
You were too busy letting your addiction control you. And I would be that honest, Dennis. And then, of course, what would happen is I'd get hung out to dry. The second that client got a chance to stick the knife into me, which is only them exercising their very limited power in this life because, their egos are so damaged, or a professional would seek the chance to offload their shitness, their crapness at their job onto you. Does this ring any bells?
Absolutely, Chris. I didn't have so much to do with the child safety part of it, even though I've certainly had there's been overlaps, and I've had that wasn't my kind of my primary area, but the same kind of thing. I guess why I embarked on the kind of position I'm in now was I was kind of when I did nursing intensive care, took a break from that. Actually ended up selling houses for a while, and I was actually fairly good at that. And the reason it's relevant, and I'll digress, but hopefully I'll get back on point,
Good.
is that this actually opened my mind to a whole other area of this kind of self-help stuff that we find. I never really knew a lot about that apart from, hey, there's Tony Robbins on the telly and nobody listens to him. So you kind of get exposed to this self-help stuff through real estate. Then I went into diving when the housing market crashed. And then because the scuba diving wasn't really so financially rewarding, then I got back into nursing. So I got back into mental health as opposed to intensive care, and I fell into a thing called drug court. See, I told you I'd get back on track. And this drug court basically was a similar setup, which was started in, I think it was in Florida in about the maybe mid 90s, somewhere like that. And it proved to be an incredibly successful program, which I think ended up expanding into about 70 different countries. It's a brilliant program, and that dramatically shaped who not only who I am, but my thoughts about mental health in general. Because about 3 days into starting this new job, I was told that I had to run what was called a cognitive behavioral therapy course, and I don't have CBT training. Okay, so I've got a room where I've got, at the time before attrition, in other words, people dropping out, like I think it was about 9, fairly hard fellas who, had been around the block with all sorts of different problems, and they were on their last chance. So the idea was they were looking at a 5-year sentence or a 7-year sentence.
Dennis, can you explain for our viewers what CBT is and what it's?
Yeah, absolutely. Unfortunately, we and I'm guilty as well, but we got these acronyms we throw around, and sometimes I think we just don't need them, and we kind of end up, I guess, trying to sound clever, and we just alienate these clients. But CBT is just cognitive behavioral therapy, and all it means is you get into a therapy, which means speaking to somebody, and you look at your cognition, which is how your mind works, and by looking at that, you change behavior. So we don't have to, have the Oxford dictionary definition of it. Okay, so it can be pretty simple. So cut a long story short, I kind of had to say to these guys, listen, I'm new to this. We're just going to have to go on this journey together. I'm going to be reading this book with you guys, and I'm going to be trying to learn. We had the most powerful situations doing this thing. We had people in tears, we had crying. The atmosphere in these rooms were electric because I was learning along with these guys, and we were just challenging the hell out of each other. And some of the guys that I was working with had really great success. So, but certainly, that stuff you're talking about, the core system, these guys, you having to, I guess, bail these guys up and be incredibly blunt, like you're doing. Absolutely, I've had experiences where it does come back in you, and because you're the front man, you're the one that's established that rapport. When the shit hits the fan, you're the one that's going to cop a lot of the negativity if things don't go to plan. That didn't happen too much, unfortunately to say. These guys kind of did No, I had their back.
explain how are these guys in a drug court? Because that sounds self-explanatory, but perhaps it's not what I'm thinking.
So basically, you've got your situation where, you know, you've got a fella who has got, say, minor drug charges, and he kind of gets let off. He gets caught again. He gets maybe a probation. He gets caught on the probation. The judge says to him, listen, this is it. Your third time. I'm sick of this. You're going to jail. And then the defending solicitor will say, will suggest the opportunity of drug court. So basically, the guy's got to commit to a 12-month program. They actually disbanded it in where I live now, which is a big shame. So he's got to go to complete a 12-month program where he has, in the initial 3 months, a lot of contact with drug and alcohol services in order to try and steer his behavior in a different direction.
Yeah, we have a similar thing here in the UK where they actually send a drug worker to the cells, the police cells in the morning, to find out who got locked up the day before and whether the police and the drug worker will go around and say, do you have any substance misuse problems? And if it's a yes, then the worker will recommend to the police custody suite, that this person is like bailed to the drug service, if that makes it, or bailed to attend this set course.
Yeah.
How effective that is, because probably a bit like yourself, I'm guessing, Dennis, I've come to realize people will only make changes when it's the right time in their life. And that's certainly been my situation. It's difficult this is the big mistake all these social workers in these child protection proceedings used to make, is they thought they could force the parents not to take drugs. And then I'd have to step in and say, I'm their drug worker. The reason they come and see me is they're battling addiction. Battling addiction means they're taking drugs. So effectively, you're telling them they can't come and see me because they're not supposed to be taking drugs. Sorry, again, I'm talking over the top of you, but I want, you know, it's not often I get to meet someone with your insight, Dennis, and I really want to, you know, exchange our knowledge base here and get some clarification.
Well, what you said there is really important, Chris, and I think you know, for me, like as I said, listen to some of your stuff before. That's such a, I think it's a real priority, is to accept that people people have got stuff to offer. I hope I'm not coming across like I know everything about everything relating to addiction and mental health, because I never want to have that position. As soon as I get to that position, I'm doing something wrong. Whereas if, you know, I love this idea of the exchange of ideas. It's fantastic. And the other kind of thing that I think is also, you know, very relevant. I don't see myself as somebody who has found all these answers on my own. I consider myself as a reporter. So I love looking at research around this stuff, and then I report stuff that works, and I try to look at that stuff that works, and I try to use it. So I'm reluctant to kind of, I guess, put myself across as the peer who is, you know, I don't think I've got an original idea in my head, but I certainly can use other people's original ideas with very, very good effect. Again, we mentioned previously before we started recording, you know, Johan Hari. And I think a lot of stuff that he puts out there is absolutely brilliant. I mean, this guy writes books, and I've gotten more valid information from his research than I've gotten from any peer-reviewed research. Okay, and I think this thing that he talks about is this thing about connection. And when you're trying to push these guys, you know, who are using drugs to make these changes, one of the things you said was they got to make changes when they're ready. Okay, but the thing is, they're never going to be ready unless they have a connection to substitute it. So if you're pushing these guys back into the same, you know, shitty lives with bleak walls and pollution and bullshit food and, you know, stress and bills and you know, waiting to be fined around every corner, they're not ready to make change in those circumstances, you know. And I mean, I'm sure, as you know, you talk about the rat park, and, you know, these rats having an alternative. We don't have a social setup to offer these guys a valid alternative.
The rat experiment, for our people listening, and correct me if I get this wrong, Dennis, was they they used to think that if you fed rats cocaine, they'd go, yeah, they'd get addicted and they'd only want the cocaine sort of drink in their cage, right? But what they found is that was when the rats were on their own, they preferred the cocaine. When you put them back into a community of rats, they started to ignore the cocaine drink and drink the normal water, wasn't it?
Well, it runs deeper. It gets more absurd, and this is why I love, I guess, having a balanced eye on clinical research. And there's a you know, we talk about heroes and stuff, and there's a few guys around who are just, I consider real life heroes. There's a guy called Peter Breggin. He's a doctor in the States. He just about single-handedly stopped a thing called psychoneurosurgery, which was lobotomies on people. And he talks a lot about mistakes in clinical research. There's another Greek guy. His name is he's a guy called John Ioannidis. He's a professor. He's got about 30 people on his team, and some of his research that he does is just astonishing. Cut a long story short, one of his papers, which is cited as the most widely read medical paper ever, he basically says that about 80% to 90% of clinical trials are severely flawed. Okay, so all the evidence that we are treating people with, we can just about write 80% of it off, okay, before we get out the door. That sets us up for a whole new paradigm. The rat park is the original rat experiment is a perfect example. You had rats and they were given a choice of two waters in only a cage. They had absolutely no stimulus whatsoever. So, I mean, you can imagine 24/7. I mean, obviously rats don't have the kind of I guess whole array of perception that we have. But I mean, if you were stuck in a cage, nothing to do, and you had cocaine water, well, I know what I'd be doing. So, and then the rat park wasn't just a community, but it was a really nice community. So they had little things to run on, they had food, they had mates to you know, have physical relationships. So this thing was perfect. And the water was the cocaine water was where this idea of chemical hooks came from. And the whole thing is bullshit. There's no evidence to suggest that there's some very indirect evidence to suggest that maybe they're chemical hooks, but there's no definite evidence about chemical hooks. And we based our whole area of drug treatment on this for decades. It's insanity.
The more I learn about my life, Dennis, you know, I used to think sort of enlightenment was this Buddhist monk walking down this pathway, chanting and saying hello to the trees, and eventually ending up in this all-seeing, all-dominant, godlike position, which is actually the story of the Buddha. What I think is you get down that path, and as everything opens up, you suddenly come exactly back to where you were again, because opens up so many more questions. That for me, enlightenment now has just been about knowing that I don't really know anything, and I probably never will, because there's so many variables on everything. Going Absolutely. Back to your point about the socializing and the people living in squalor, you know, yeah, I get that. I mean, some of the people I work with in drug treatment had nothing in their lives, really. They had the shitty flat. They had the family that was real bad examples, you know, spending, you know, maybe the dad had always been in prison, all you know, really all the stuff that doesn't make for a functional, supporting family and this kind of thing. And I used to see that, yeah, they didn't have an alternative to step back to. They'd only ever known shit. Therefore, they continued their drug use because that was just continuing the shit, right? What I'm trying to say is people like me, I actually had social capital because my life hadn't always been, you know, just a drug binge, living in a crappy house. My life descended into that. And when I hit rock bottom, I could go, hang on a sec. My life did actually used to be like that, quite good. I'm talking about my adult life. Obviously, my childhood was probably the primer where all the trauma was experienced. And So I got to that rock bottom point and thought, hang on, this kind of isn't working anymore. And I had something to relate to and start clawing my way kind of back out of the pit, or forwards out of the pit, I should say. Whereas for some of the people we're talking about, they don't have that. So the rules for them going into recovery and the rules for people like me, it's a different, you know, there's some certain parallels in our psychologies and stuff, but there's so many different variables.
Yeah, and it's really interesting you say that, and it's fun. It's quite, and I guess one of the missions that I'm on, and one of the drums that I'm beating is when we have these type of discussions, we're missing a huge part of the puzzle. Okay, and the part, and I've literally, when I started in acute mental health, which is you know, kind of very serious level schizophrenics, all that kind of stuff. I remember saying to my colleagues, and I would have people going, no way, and they'd sit down and look at this in Google. We miss some fundamental parts of the equation. And what I mean by that is, for example, serotonin. Okay, serotonin is a massively important chemical that's used for all sorts of things, including improving your mood. There's still doctors there that can't tell you that this is produced mostly about 90% in your stomach. Okay, we got this word that's, I don't know if you knew that, Chris.
Serotonin.
Yep.
Had no idea. I thought it was, wasn't it one of the Kundalini sort of chemicals that's released by
DMT. That's a dimethyltryptamine. I can't remember the end of that. So that's a psychoactive type of substance that we do produce in our bodies, but it does come from.
They say the milk and the honey, though, don't they? So what like the milk is the DMT. It wasn't the honey, the serotonin, or am I?
So serotonin is a chemical that we actually produce in our bodies, okay? Yeah. And we have ranges of different drugs that act on serotonin production in our bodies, okay? And the reason I make the point about that being produced in your stomach is we have this system, and again, this is another drum I constantly beat, and it's just almost ignored in mental health circumstances, which is a huge frustration for me. We've got this system called the microbiome, which is the bacteria in your stomach. They make serotonin. Okay. Now, when you've got a cohort in a population that is on the lower socioeconomic scale, these guys coming right off the bat are severely compromised physically because their gut bacteria is absolutely screwed up because they're being fed ridiculous and horrendous diets. So in other words, these guys are not educated about how disastrous things like Coca-Cola or McDonald's, all these things that are thrown into our face by media. So just right off the bat, when you're talking about trying to recover from addiction, physically, these guys are just not, they're up against it before they're even out the blocks. The other thing, which again is another drum I continually bleed, is to pull this focus more away from the head, but into the rest of the body. Okay, there's an excellent doctor out there, and I always recommend her work. Her name is Stasha Gomenak. Hopefully I'm not going to get too technical with this, but vitamin D is responsible for making all our neurotransmitters. Okay, now she's got this hypothesis, and I think she just hits the nail on the head with this, is this move from what's called pastoral living. In other words, you know, on the farms and, you know, making stone from the quarries and all this kind of stuff. The industrial age stuffed that up. It put us into factories. So we're not getting sun exposure every day. And not only that, we're mimicking factories with schools for our children. So we basically have a severely malnourished population. And this malnourishment is the cause of neurotransmitters, is one of the building blocks of neurotransmitters.
I'm going to jump in there because I think I've got an interesting point. I did an 18-day water fast.
Wow.
I did it just before I ran the length of Britain, funnily enough, which kind of helped me because I lost 3 stone in weight. But it's a fascinating experience. It's nothing to do with diet or weight loss for anyone listening. It's not about how you look. It's nothing to do with that. It's about purging your body of fat, and in that fat is stored lots of toxins and I believe lots of acid, and getting your it's basically resetting yourself to nature's balance. And after a few days of doing it, you enter this state of nirvana, absolute heaven. You feel as though angels are just carrying you through life. And I like to think that's how, as human beings, as hunter-gatherers, or whatever our ancestry truly is, that's how you should feel a good percentage of the time. I'm not sure if it's the same as the Kundalini serpent power spirit that you can invoke, but because I live the alkaline diet, so I try to live as close to, I try to keep my body in the right state, and I exercise every morning, or I at least have my morning routine. I feel this lovely, I sometimes just have to stop work at my computer because I just feel so brilliant, Dennis, But what the point I wanted to make is there is a reason why human beings react well to fasting, and also why we can fast, why we can go for 40 days without food and then pick up and carry on without any detriment or apparent detriment to our health. And here it is. It's that nature is so clever in evolution, however that works, I won't pretend I know, is that it facets everything that we experience is what is then combined to make us continue to the next decade and the one after that. So nature realized that humans would have to fast because there wouldn't always be food around us. We might have to travel for 40 days to a new food source. Snow might come down or flood and all our food is gone. Nature knew that. So genetically, the ones that could get through that 40 days are obviously the people like myself and yourself, Dennis, that are here now. Our DNA allows us to do that. But at the same time, nature's so clever, it's letting you detox through this very process, which keeps your body in balance and keeps you in kilter. And any acid that you've accumulated by having to eat not strictly the right food stuff, so your starches and your overabundance of protein, the acid that your body stores that leads to ill health is then purged, and we go again. Going back to what you said something there that really reiterated this, and for the life of me, it's slipped my mind what the point you were making.
The point I was making, Chris, and again, it's so overlooked, and it's one of the most important. I've got a program which I put this program together specifically for this because these points are missed. And the way I think about things like depression and even an addiction relates directly to this is there should be at least a trifecta. Okay, so all that stuff we talk about the social stuff and the connection and the hardship should be just one part of that trifecta.
Oh, Dennis, can I interrupt?
Yeah, please.
Sorry, it was the vitamin D. The vitamin D.
Yes.
There's a reason we're animals that live out in the nature and get sun, daylight all day long. Nature has factored that into us as part of our, continued existence. And what you said about chucking us in, in schools and then into a factory or an office or what it might be, has to have some derogatory, detrimental rather, effect on our well-being, because that Mother Nature in her wisdom has used that factor in our makeup. And if you take any of these factors out, you're not achieving that harmony that we're all supposed to have. So sorry to interrupt again, Dennis. But
you're kicking out the park, Chris. And this is something I'm really passionate about, and this is why I'm kind of doing a lot of stuff on LinkedIn and talking about a lot of this, because it's so undervalued. But you've just covered so many really, really important topics. The vitamin D is massive. The vitamin D is a precursor for other stuff in our body and for neurotransmitters. We work all day. Then what do? We go for a walk, 1 hour, maybe if we're lucky. Then we get back inside and we're watching television. So we can all be considered malnourished for a start. The other reason we're malnourished is, ironically, and I'm going to segue into a bit of a diversion, is because of World War I. Okay, you
Okay.
might think what's that's got to do with it, but when bombs were being produced in World War One, especially in England, the kind of industry started in England. You had this massive leftover of nitrates. Okay, nitrates make plants grow. Okay, so farmers were sold the idea that they didn't have to do crop rotation because they could use nitrates. Massive problem with this. Okay, we have now soils that are absolutely bereft of massive amounts of nutrients.
Yeah.
Okay, these also make our neurotransmitters, which make our happiness. So again, another reason for malnourishment. Okay, and then the third part of the trifecta is exposure to blue light. There's a whole area of medicine now opening up. It's called circadian medicine, and it keeps us in a cortisol response. Okay, so when we're talking about these, yes, we got these apparent, apparent scientists. I have to question their brilliance, because I hear we don't know why millions and millions of people are getting sick. Really? Are you serious? So, when we talk about these guys that you're talking about, who, are you're trying to get them to change from serious drug abuse patterns. You try and get somebody who is compromised from all these physical problems that it mightn't be obvious, but I'll tell you now they're compromised. So, and the stuff you're talking about, the fasting and the running and the exposure to light, this is part of healing. This is how you get better. So we have to have a much more serious focus on this other part of the whole equation. Then we're going to start getting people out of serious drug problems and addiction, and depression and anxiety.
If we ever do. I mean, it's so funny. There's a time in my life, obviously, I think like most good-mannered, or should I say well-meaning people, you look for the answers to fix society, right? The planet, as we know, will be fine. It's going to be here forever. Even if it explodes, these molecules they're not going anywhere, right? But the planet will be fine without human beings. But you look for that kind of, there must be a better way. Well, I'm pretty sure there is a better way. But then I wonder, is that better way just like the way we were before we had technology? And then to the other side of the coin, I think, actually, should we not care about anything? Should we literally just almost like adopt a mindfulness approach to the insane way that this civilization is going, clearly going to wipe itself out, pays token attention, does the bare minimum to rectify any of its mistakes, its pollution, it's and does everything to just stay in line with this conformity that's put on us by these greedy little men in their ugly little suits and their lack of personalities. We just go along with it, don't we?
You're preaching to the choir here, my friend. I think it's quite insidious, and it's born. I mean, you can kind of go down a kind of sinister type of line with it, or you could just say that this is a thing that's evolved because of our natural, I guess, evolutionary drives to progress. And part of that is when you reach a certain level in society, you're going to strive to get further and further. If you're in that lower cohort, you're still going to try and get a slightly bigger car, a slightly bigger television. Personally, I think that it's a little bit more sinister than that, and I do think that that the profits of large industry are derailing general health. And it's a self-perpetuating model that means, unfortunately, the more addicted you are, when we talk about addiction, it's perfect because we all have these addictions, whether it's to technology, whether it's to certain food groups, whether it's to not exercising. The more consumerism that's forced upon us, and the more we accept that, this is, we kind of end up in this downward spiral. But on a positive note, especially since doing a lot more work on LinkedIn and kind of connecting with some great people, there's an awareness out there. Even looking on YouTube, there's people who are starting to get this stuff. And this is why I think what you're doing, and especially in your chats about mental health and chats like this and people listening to this stuff, this is the stuff that I think there's enough people who get inspired to I guess try and deliver that truth.
Yes. I don't know what you call them. I think everyone envisages them under a different name, and some people just don't even care or aren't even aware, whether it's, you call it big business, elite banking families, Illuminati, Khazarian mafia. I'm not going to say the J word because personally that's so misleading.
Absolutely.
Mainly because I know many wonderful people from that ethnicity, and it sounds like a blanket term. The Khazarian mafia thing is interesting because that pinpoints certain people, individuals within that religion, as opposed to the whole religion. But they're very clever. Either way, this kind of agenda, as David Icke would call it, knows how to play the human mind, and they know how to do it so well. And this coronavirus is a prime example. I mean, it's the utter lunacy of the measures people are going to protect themselves from a virus that's not even as dangerous as the normal flu, or if it just shows you the power that these people have through their media, which they all own, to plant these little devices. That's all it is, knowing how easily, it's, and for anyone listening, to give you an example of how easily fooled we are and controlled. There was a picture circulating on Facebook of Tony Blair traveling back from the Middle East, so say Iraq or Afghanistan, following one of his sort of ministerial visits, for want of a better word. And he's flying in the back of a Hercules, and he's reading a newspaper, and he's got his feet on the coffin of a dead British or American soldier, and it had the flag draped, right? That picture caused uproar. People honestly watched it and just didn't realize it's obviously a Photoshop, right? Tony Blair, in all his evilness, isn't that stupid that he's going to allow himself to be photoed with his feet on top of a dead service person's coffin. But that is how easily the mind can be tricked. Just like that. You don't think, oh, Photoshop. You don't think, oh, hoax. You don't think, oh, someone's trying to, you look, you react. And to that end, as much as I love to have that notion that the world is awakening to this, I do wonder, are they? Is it just that people like ourselves, we're in this circle of like-minded people that actually care about other people and the planet? Or because at the same time, people are getting really thick.
Well, is it thick, or is it I guess be the victims of a stupor, okay? And what I mean by that is this hypnotic stupor based on, and I've said this for years, especially in the area of health. The model of addiction should be transferred to every single area of health, whether it's hip operations, asthma, you name it. Because if you think about it, somebody who, let's say, is a diabetic and they're not taking their insulin, what you're talking about, and you talk about this with addiction as well, is this model of the stages of change. And I'm sure you know a lot about this, which is pre-contemplation, contemplation, action, maintenance, and preparation, if you wanted to chuck that in there. Okay, so somebody is non-compliant with their insulin, their blood sugars go up. You're trying to position them in a place for change, to be going from inconsistent to consistent. And you can use this model for just about everything else. So we have and this is why I never think of addiction as black and white. It has to be on a gradient from mild to severe with absolutely everybody on that gradient of mild addiction. I certainly am. I'm to find myself going through these compulsive checks of my LinkedIn sometimes, and I've got to take a step back. I find, and again, we look at things like Google and Facebook, and I don't want to kind of call out anybody too severely, but these guys are putting literally billions of dollars into market research. So these guys are not just developing accidentally. These guys have got the top neuroscientists in the world. They've got the top psychologists in the world, and they are in hordes trying to find out ways to have us as more valuable consumers.
Yeah, to
so
make in essence, to make you as addicted to their product as they possibly can without it being blatantly obvious they're flagrantly violating your human rights.
Absolutely.
Let's just talk about the cycle of change model, or the stages of change model.
Yeah.
For anyone interested, and as Dennis said, it's vital to understand this, to understand yourself, to understand people's motivation in life, and to understand why change is made. I've done a video on it. I believe the video, have a look in my life coaching playlist, the Commando Coach playlist. I think I call it Break Free of Addiction, or so, you'll see the one when you see it. You'll realize when you see it. But should we just talk about that, Dennis, and talk about the different, let's outline the different stages and then explain why they're so important.
Absolutely, I agree fully with you, Chris. And again, we and this frustrates me a lot with psychologists and sometimes psychiatrists is this partitioning of knowledge to an unattainable level. We don't have to make it complicated. We can simplify stuff, and this is why I like this model about the stages of change. So essentially, depending on what model you look at, it's easier to go with 4. You can go with 5, but the first stage is pre-contemplation. Okay, and it's really easy. I've got serious alcohol problems, and you identify this and you say to me, hey Dennis, man, your life's not really going so well. I think you should cut down on drinking. And I tell you, get lost. That means I'm not ready. I'm not contemplating. So it's the level before contemplation. You might catch me after I lose my job, or my wife dumps me again, and I'm fairly upset, and I think I'm going to change everything. And you say, hey Dennis, that chat we had about alcohol, I think maybe you should think about it. And I go, you know what, Chris, I think you're right. I'm going to contemplate giving up. Okay, so that's contemplation. You can add a stage in there called preparation, which means that we have a bit of a chat, and you say, hey, maybe you should think about maybe seeing a counselor, or maybe getting a diary, or you might want to do some exercise. You might want to join me. And I'll go, yeah, listen, I'm going to.
Might want to pour the alcohol down the sink. This kind of stuff.
Absolutely. So now I'm preparing for the biggest part of change, which is action. Okay. Now the thing to realize is it's not linear. You can drop back and forth between them. And this is what we don't understand. This is what sometimes we don't accept. And it's a big problem, because as clinicians, sometimes we go on the journey of stage of change with somebody, and they drop back a level, and we go, oh, you disappointed me. And we almost take that personally. And we have this idea of losing faith in that person, as opposed to understanding that this is normal. We call it ambivalence for whatever reason, okay? And the idea as an effective clinician is to try to facilitate people moving between the stages of change.
So I just want to put that in layman's terms, Dennis, for those. No, it's fine. It's just I'm aware this is a fascinating discussion, but for the people outside of the medical social circle, might be struggling to keep up. What Dennis is talking about here is known as lapses and relapses, right? So a lapse is when you've decided to take action about your addiction, you've poured your alcohol down the sink, you do really well for 3 weeks, and then one night your mate goes, here, pint, and you go, one won't hurt. You neck the pint, you have another, and you wake up with a banging head and you go, what did I do that for? I already decided this isn't the life for me anymore. Why is it great? Because I kind of always explain it, you can only go one way around the circle, or your life can only go one way. And it's great because you go back to you go right the way around the circle. When you go to the action stage again, You don't have to do, you know, all the contemplation thing in such depth, and you go back to the action and you're abstinent again. And that's great.
So important. So important.
The relapse is where you have that drink and bang, you go right back into the cycle again. You go right back to the pre-contemplation stage, which you might hear referred to as denial. And that, well, Chris, I thought you were stopping drinking. Yeah, well, no, there's nothing wrong with this. You know, at least I go to work every day. I can't be an alcoholic. And it's like, yeah, but last week you were saying you did recognize you had an issue with alcohol. Oh, well, you know, you can do that. Where it's become problematic, and at the seat of the problem, Dennis is very adeptly highlighting, is that the AA movement do not recognize this stages of change model, because the AA and NA movement, the Alcoholics Anonymous, blah, 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 started before we had this kind of science. They didn't understand any of this. So they just said, if you lapse, you failed. There's nothing to be learnt by it. You're a failure. You have a disease, and you're never going to get rid of it. So they just practice bang, abstinence, full stop. Just don't want to get too much into that debate, because I will say, Mum, as you probably heard me say, my friend drank himself to death a couple of weeks ago. My other best friends, these are two best friends of mine, drank himself to death last year. Had they gone to AA, I would have been like, good, just good. So there is horses for courses, right?
Yes.
But the issue with that model of abstinence is it misses out this valuable understanding of the stages of human change and human growth that Dennis is outlining.
Absolutely. But again, you've totally hit the nail on the head there, Chris. But the other thing is that there's a few things when you talk about lapsing and relapsing, which are also really important. But one of the biggest things is when you decide as a clinician, or when your group like AA or NA, for whatever reason, decides that you failed, you've just lost one of the greatest antidotes to addiction, which is connection. So not only is that almost like a self-fulfilling prophecy, you're not good enough to be in the group, you're telling yourself that. Okay, so it validates your perception of yourself as an addict, and as a failure, and as somebody you will never get out of it. So then you're trying to justify it. Okay, so I think this message of connection and kindness and compassion is a massively important one. So you're not. It's so difficult if you have somebody who in a family situation is continually messing up, or not getting to the daughter's birthday, or not buying the presents because of addiction. It's really easy to alienate them because they're just hurting you all the time. But again, that's part of the problem. And I don't know a really sure way around that, just apart from, I guess, self-awareness, to be looking inside yourself to see where your revulsion comes from, or your disappointment, or your anger, or your hate. And I guess to gain a bit more awareness, to have that compassion and understanding, because
I didn't have a problem experiencing drug addiction, Dennis. That per se was a phase of my life. Did some really stupid things on it. Possibly maybe took a few years off my overall lifespan. But the actual drugs, even sticking needles in my arm up to 12 times a day, I didn't have an issue with it then, don't have an issue with it now. What damaged me, what made it a tough experience, is nobody would accept me for who I am. I was just being myself. I was trying to find the answers in my life. I'm not saying there wasn't better ways that are available to do that, but for me on my journey, they weren't available, because if they were, obviously I would have done them, right? So I'm in this situation. I'm caught up by addiction. Addiction is where you've learned this pattern of behavior that initially works for you, i.e. taking the drugs, and then you get to a point where it stops working for you. The drugs aren't fun anymore. You become like the last drunk at the party when everyone's gone home to sleep and look after the kids. You're at the bar going, hey, come on, next. And everyone's looking at you going, Chris, like, party's over, dude. Come on. And the thing was, I then had to live in this world where my family wouldn't accept me, Dennis. Used to just shake, you know, they're not horrible people, not at all, right? You know, okay, you know, ups and downs over the years, as I'm sure my friends out there have gathered. But the thing was, they rejected me. They said I was a dropout, right? I'm a Royal Marines commando, and I'm being told I'm a dropout. That you know, what I mean is, I'm no longer a Royal Marines commando that they used to worship and think I was so ace. Now I'm a reject from society, and that stigma, that is what damaged me. That Absolutely. Is what rocked my confidence. That is what gave me crushing anxiety attacks where I couldn't even speak because I was in such a state of trauma that I would
confirms your reality.
I'd be like this. I couldn't speak. I was that gripped by anxiety, worried about what people thought about me, and so yeah, like, I hope that ties in more with what you were saying.
Absolutely, but again, it's so multifaceted. But the actual chemical responses you have from alcohol and drugs on their own cause anxiety. But then the turmoil that you've got on top of that adds to it. And unfortunately, we would diagnose that as an anxiety disorder. It's not an anxiety disorder. It's a facet of addiction. This is my other kind of drum that I beat. Things like depression and anxiety are more often than not, they're not diagnoses, they're symptoms. They're coming from someplace. And the amount of times I've seen people address some of that other stuff I've talked about, which are diet, sunlight, adequate nutrition, these symptoms clear up. Okay, and again, it's convenient, I hate to say, to have a diagnosis as opposed to a symptom of depression, because then you can get an antidepressant.
Yeah. The whole situation with depression is complicated. I'm almost hesitant to touch on it because I've only experienced what I've experienced. Mine was drug related because when I had my come downs off the drugs, I went back to this rock bottom layer of depression that I lived in for a year and a half. So I get what it's like to not be able to lift your head off the bed because, but there's no reason to. You have nothing in you. There isn't, you know. I get the feeling of utter powerlessness. Like I think the reason I say that is, you know, you can feel depressed, which is waking up, life ain't going the way you want it to. You've had an argument with your best mates, you can't cry on their shoulder, and it's just, you think, frick it, is it worth bloody living anymore? You know, that's what I call feeling depressed.
You almost put it exactly the way I describe it. And it's really helpful to, I guess, to I think have this picture of this, okay? And I break this up into two things. So one is having depression and the other is being depressed. And the important thing to realize is that they both can feel exactly the same as each other. They can be both as severe as each other. But if you have depression, it implies a diagnosis. If you're depressed, it implies a symptom. And for yourself, for example, your depression would more than likely have been a symptom of your drug use. Doesn't mean to say we trivialize it. It would be as hard hitting. You could have easily killed yourself because you had that symptom. So I'm not trying to say that one is more or less important than the other. They're both equally the same. But to have a state of being depressed implies that you can get out of that state. And I think this is why I'm always belting on about the important use of language and how it's so important not to create these realities, because once we have these certain kinds of sentences and words in our minds, we're creating our realities. And we're not only doing that for ourselves, we're doing that for other people, and we're doing it as clinicians. You know, another thing, hopefully cut me off if I start rambling, is this concept of nocebo. Have you heard of this?
No.
And it's incredible. And everybody should know about this. Anybody who is going to any kind of place where they need some kind of treatment, whether it's medical or mental health, should be aware of this. We obviously know about placebo, yeah? Placebo,
Yes.
just so people are aware of, it's been used throughout history. We've got records of placebo since the Egyptian times. It's incredible. It became a mainstay after World War II, where a guy called Beecher was trying to do surgery in the field. They ran out of morphine. His nurse gave this guy saline, and Beecher was going to stop her, but he didn't, because the soldier relaxed and he ended up having surgery in the field thinking he had morphine. This is called the placebo effect. It's powerful. As a result of Beecher, every single tablet now or medication is tested against a placebo to see how effective it is, okay? We have the opposite. It's called nocebo, and there's lots of sociology studies done on this, okay? Now, we got sociologists and anthropologists who write about, for example, in Haiti, those islands where you had dolls like pincushions, and hexes put on people. And within, let's say, a villager was hexed and they had 3 months to live, that guy sometimes would die within 3 months. Okay, it's an incredible psychological thing, whether there's kind of some energy stuff that goes on or whether it's a purely psychological thing. All that stuff is up for debate, but what we know is it does work. We've got a few examples of this in medical literature. There's at least 2 that I'm aware of, and a few others that I came across, where there's a couple of people who had a diagnosis. One was of liver cancer, and they were given 6 months to live. They died within 6 months. On the autopsy, they did not have liver cancer. They died because they received a diagnosis. This is called a nocebo, or medical hexing. Okay, there's an infamous story about a guy called Mr. Wright and a drug called carbamazine, which was this cure for cancer that came out in the 70s, I think, from memory. And this guy had these massive tumors hanging off his body. He was given this drug with days to live. The doctors thought he'd die. They came back on the Monday after the weekend. This guy was walking around talking to nurses. He read about the fact that carbamazine was bullshit and he got sick again. The doctor was really guilty. He told this Mr. Rice, listen, you didn't have the one we normally give. You had the better one. He got better even quicker. Then he read a report in a financial piece about the drug that it was rubbish, and he died within a couple of weeks. Okay, it's incredible how powerful our minds are. And so I go back to nocebo. So bearing in mind this guy who got this liver cancer diagnosis, by giving diagnoses to people, we can trap them. If you didn't have depression, and I'm a doctor, there's a load of things. There's a guy called Irving Kirsch. I highly recommend everybody look at this guy's work. He's been doing work for about 20 years in this. It's incredible. If we have a good peer rapport and I say to you, hey, Chris, I'm going to diagnose you have depression, even if you didn't have it, there's a 30% chance you'll get it, just because I've uttered those words to you. And this is the thing that I'm hell-bent on trying to let people know about, is beware of a diagnosis.
Yeah, of course. Incidentally, we should say any links you've got for all these books, these great books you're recommending, Dennis, I'll put them below if you could send me an Amazon link for them or whatever.
Great idea, Chris.
Yeah, it's incredibly. When I worked in Mozambique, this bloody it's voodoo in Haiti. It was traditionally called voodoo, right? In the Caribbean region. I don't know if that's a Western word but
juju, I think, is one of the words again around
there.
Yeah.
And it's taken so seriously. It's taken so seriously that when I worked in Mozambique, one of the teachers, well, I wasn't my role there was a teacher. I was actually a development instructor, all voluntary, but I worked at this street children's school for 6 months. One of the other teachers that came from Europe was a chap who was born in Mozambique, but he'd been adopted by a Danish family at about 2 years old. So his identity was Danish, right? He'd lived until he was 20, let's say 24 in Denmark. So 2 years born in Africa, the rest of his life till 24 brought up in, let's say, our culture, right? What European culture. Within very short time in Mozambique, he had literally the word gone native, the expression gone native is quite appropriate in this situation. He started to socialize, hang around with, I'm trying to pick my words accurately here, his fellow Mozambicans, you know, his Mozambique,
culture.
right?
Yeah.
So he's hanging around with his fellow, and they're having this influence on him, of course, with all their local customs and etiquettes and this kind of thing. And they were a bad bunch as well. I know that because the group he was with, we used to have to keep our eyes open because they'd come and steal stuff from our house. So not a good situation. But then he develops this skin disorder on his face, and his lips started all peeling off and stuff. It was a medical condition. And he came up to me, and he's looking disheveled. He's not the guy that I knew when I first arrived there. He's just no longer this guy anymore. He's this shell of a man. And he's talking about going to the witch doctor, of which they have as many now in Africa as they ever did do, certainly one in each village. And I'm trying to rationalize with him, going, do you really think, you know, you've got a skin in it? But here's the thing. Simply the power of all of this stuff that it's having on the human mind is so controlling or determining in itself. I mean, if you take a doll and you stick pins in it, and that's the vibe you're putting out, and you know, you've only got to show that doll to 2 other people who then go out and start doing this. Before long, you're being ostracized by everybody around you. What's going to happen? Your mental health is going to collapse inwards. Your physical health is going to follow suit. And before long, I completely, mind is so powerful, isn't it? I'm also interested because during this time, my sort of addiction years, I was very much of the attitude, well, fuck everyone. You're going to ostracize and isolate me because you're judging me. I mean, I effectively hadn't really done anything wrong. I did a few stupid things, like I would shoplift, tried to steal a car once. I'm talking about during my addiction phase. This is, I've done other stupid things in my life, which no doubt will come out in my memoirs. But the point is, I got to the point where if I walked down the street, suddenly, I remember once I had this big anxiety attack. I'm guessing that what it was, a panic attack, right? Because I never been to see doctors because I don't get on with that. You know, I don't get on with being labelled. It's like, don't call me that. Don't tell me I'm that. I'm Chris THRALL. There's nothing wrong with me. There never will be. And anyway, I'm going off on one. But the point is, I got to the point where I could have this massive surge of anxiety because in my very drugged up mind, all the people in this street are so conscious of me and my behavior. And I just flip it and go, well, all right, I'll do without any of you, you know. Got to the point, I mean, there was one point in Hong Kong, people would have heard me talk about this, where I genuinely thought I was going to be murdered. And I took the same approach then. I'm like, all right, you know, murder me, but if you think you're intimidating me, you're just absolutely not. I wonder how that stands me instead now, if the whole of my community would have turned around and ostracized me, whether I like to think I'd just be able to go, you know.
It's fascinating, and you know, I kind of referred to this program I've got going before, but at the end of it, I cover a lot of stuff. And one of the things you never hear discussed again, and it kind of baffles me because it's so friggin' relevant, is the importance of quantum physics in mental health. And I might throw a curveball at you here. I don't know if you're interested in it, okay?
Well,
But
Dennis, sum up quantum physics like in a sentence for us.
Sure. Listen, if I could kind of sum it up in any coherent way, I would be I wouldn't be in this profession, but I'll give you my layman's explanation of it, which, you know, doesn't in any way do it justice because it's such a complex kind of area. But quantum physics essentially is the physics that happen when you break things down to a smaller compartment than an atom. Okay, so you're looking at all that stuff that happens deeper than an atom. And I got to cut me off here if I kind of go a little bit too deep with this, because I'm a bit of a nerd with this stuff. Okay, but it is relevant to mental health. Okay, and the reason, put your hand.
I need to find the answer to the universe, the meaning of life, Dennis. So you're never going to go deep enough for me unless you know it.
I know, I certainly don't, but it's a very interesting concept. But one of the things I find absolutely fascinating, okay, is a couple of these guys that are ignored by mainstream Newtonian science. And there's one Russian, there's quite a few actually, but you got a few names like Schrodinger, which is the Schrodinger's cat thing, and there's one guy in particular, a guy called Kozyrev, a Russian scientist who kind of, he was locked up in a gulag for many years, so he had to do his experiments from his memory from a gulag. So he wasn't exposed to a lot of ideas in about the 20s to about the 40s. And he ended up making all these predictions which were laughed at about how the moon worked and stuff. And he got all these things on the head. It was really funny. One of the things he was recording from his experiments, and he's got this quote that was translated from Russia, something along the lines of, when I am thinking about the mathematical problem, I get one set of results. But if I'm thinking about my favorite music or my favorite poetry, I get a statistical difference in my results. And this was consistent. And the amazing thing about this guy's results are they're replicatable, okay? With quantum computers. And again, I'm kind of, hopefully I don't get a little bit too deep with this, but with quantum computers, there was a few people who did this thing called a double slit experiment. Okay, and when we get down to quantum particles, it seems to be, so Newtonian science means that we think that you and me are little solid bits that are just spinning around each other like little universes, okay, and this is our atoms and our molecules. But when we get down to a quantum level, Western science tells us this is not the case, okay? And this was proved by this double slit experiment. So they fired these photons through these two slits, and it looks like they're not solid until we decide we're looking at them. So they're not solid before we look at the experiment. And as soon as we look at the experiment, they actually end up looking like they're solid. I could break that down more, but I don't want to accuse the hell out of you. The other thing which they've worked out with this is before they go through the slit, they're in a state of what's called superposition, which means that they're doing everything at once. So you can have one particle before it goes through the slit experiment, going through the left slit or the right slit, or both together, or none at all. How they work this out is beyond me. But the relevance of this, okay, is that our consciousness, literally observing, affects the result of the experiment. Okay? So we can extrapolate this and say that our consciousness, if it affects those molecules, guess what? It's going to affect the molecules here, which is our bodies. Okay? So not only do we have this paradigm where we are influencing our reality by our belief system, okay, there's actually scientific precedence. So this is Western science as well, by the way. This is not some strange, even though Hindus, those kind of other alternative science do suggest this. Western science also has this as a precedent that our consciousness influences matter. Okay?
Yes, I've heard this.
So, and we have precedents for it. This is proved in experiments. So you can't tell me that if you are in a state of, and I use the word deliberately, not depression, but a state of being depressed, you can't tell me that this not only is having an impact upon your atoms and your molecules, but it possibly is having an effect on the atoms and molecules of what you're looking at. In other words, the people around you. Now, how much that factors in to you having a control like voodoo or et cetera, or sticking pins in dolls, or whether, you know, there's obviously we know about pheromones which influence how people think about you. So I hypothesize, and I'm not the only one who hypothesizes, that there is something much more significant going on when we have these belief systems. So this belief about love and kindness and recovery are vital.
Oh, yeah.
Huge segue, I know. Big segue.
No, wow. My mind's just trying to take it all in. It's fascinating. You've just invoked a few topics that I've briefly touched on, but found fascinating, would love to know more. Part of the thing I don't like about trying to forge a career that doesn't involve working for someone else, which I'm never going to do again. Life is too short. But it's that it takes a lot of time. I spend a lot of time doing this and editing and writing and this and learning. The learning I have to do each day just to figure out maybe how to put one little snippet in a documentary that I'm, you know, that can take me 2 hours, right? Anyway, what I'm saying is the downside of all this work that I put in is that I could quite happily read all day long.
Yes.
Because there's so much to, I don't want to say learn, it's not the right word, but to make ourselves aware of it and to just open our consciousnesses up to more possibilities in this amazing life. One of the things I work on a lot in my head, because as I said, I'm going to learn the meaning of life for people. So bear with me, Dennis. We'll have this conversation next week, and I'm probably going to be there, right? If it's not next week, be the week after. But my theory, it's only a theory at this stage, I haven't proved it, is, you know, as much as you can go outwards into the universe, infinitely, forever, it never stops. You can go the polar opposite, obviously, because there's no rules. You can go in every direction, but you can go into this atom. You can go into every single atom that makes up this, I've forgotten the word again. What's the name for a computer simulation, right?
Yeah, a construct, a simulation. Yes.
You know, if you think of it as a simulation, you can go inside every one of those atoms, not just to the atom level that you mentioned, and but to the quantum physics side. I'm guessing because I really don't know much about quantum physics, but you can go into that atom infinitely. Of course you can, because it doesn't stop. And if you go into that atom infinitely, do you come back out where you left the universe infinitely?
Well, here's the interesting thing, and a few people have hypothesized about this, and I can't say it would be an incorrect hypothesis, okay? But we always have these levels that are broken. There's a guy called Rupert Sheldrake who actually does some really interesting stuff about kind of telekinesis type stuff, but that's another segue. But so for example, you know, we were looking for electrons, and then we're looking for something smaller, and then we're looking for protons, and et cetera, et cetera. But the kind of latest journey that we've embarked on is one with the Hadron Collider underneath Switzerland, where they finally think they found this thing called the Higgs boson particle, which is meant to be the smallest particle ever. And one of the hypotheses which I heard, which I thought was really interesting and it made me think, was every time these scientists go looking for something specific, they find it. And could it be that literally that mechanism of just looking manifested? It's possible.
Yeah.
It's possible.
One thing I noticed, and, you know, I'm going to say this openly, it's a big part of the reason I try to keep my act on the book. I was going to say clean up my act, but I hate that word clean, especially when it's associated with drug use. That was one of the biggest challenges I found working in as a drug worker, as a substance misuse specialist, was that you had three mixes of people. You had those with drug experience and those without. You had those with experience of the AANA system and those without, and you had those with university degrees who not only had the knowledge and possibly the experience, but also they can theorize why this is and what is best practice. And that, you know, I really found that hard to deal with. But basically, you're working with people that don't know what you know, but they know what they know. And I'm not saying that, oh, my knowledge is superior. I'm not saying that at all. But what I'm saying is science is always superior. I don't mean the science where they try and tell you we've been to the moon and all this, you know, where science is abused to control the individual. I mean science in its purest definition.
Yeah, absolutely. So what you're talking about is you're talking about objective facts. So when you see objective facts, that's not your opinion. That's exactly. There. An example is an objective fact is these workers that had come from the AA 12-step program because of their own history of addiction would use this term clean, and they had no idea that from a science perspective, the way we talk to each other, like you said, has a bearing on the person we will be. It affects us. If every day of the week, the year, your life, you wake up, you look in the mirror and you say, I am a fucking loser. I'm going nowhere. Guess where you're going, Dennis, isn't it? You know, guess where you're going. Yep, you got it. You're going nowhere because you're programming this very fragile thing called the mind in such a negative way. You take what's the opposite of clean?
Yeah, exactly. Dirty.
Absolutely. So it's an implied word, even if it's not put out there. It's you are dirty.
The other thing I'm segueing back and forward here, but it's great. It's great. The other thing that got me there is, again, they're completely missing the stages of change model.
Yes.
It's not bad to relapse and be unclean, as they would never use the word unclean, but the insinuation that you're clean or you're dirty completely overlook the most important part of change, which is relapse and relapse. That was one of the bugbears. But segueing back to what I was originally saying is I clean up my act now because I noticed when I was abusing drugs and alcohol, I should put this in context. So I'm going to sound like more irresponsible than I feel. I was on painkillers for a long time because I've had 4 back surgeries now. And I include all prescription medications, I'm sure you do, as a drug. You know, I don't care if something's illegal. I care about the moral effect that it has on your life and your well-being. So I was on a huge amount of painkillers and I was drinking because I drank for, well, you know, I started drinking when I was 14, maybe 12. I'm 50 now, so what's that, 38 years, right? I drank habitually, so for 27 years, pretty much every single day, right? Then, of course, I met my wonderful partner, and she made it clear that she felt having a child was important to her. So that, for me, isn't just a decision about should I have kids, you know, with this wonderful woman. It's about, can I be responsible, Dennis? Because look at my history. I ain't putting that shit on no child. And I'm just so lucky that I wasn't one of these parents that we talked about earlier that has the social service involved. Because had that been me back in my drug problem, my addiction problem days, had I had a child, I mean, you know, it's a fabricated scenario. I didn't have a child and I'm lucky. But had I had one, my God, I hate to think how my future could have turned out. So now, yeah, I'm trying to make the right decisions in my life and be strong and keep this positive mental programming and keep my routine and do my morning routine and use meditation and positive vibes to relax and remind me that I don't need this other stuff, and that it's an illusion. You know, drugs and alcohol are an illusion. And obviously the big part of that is that I've got a son now to set an example to, but also it was that when he first came around, I was still drinking a bit and taking this medication. And I noticed when I had my, like, the bad part of a, if we can call it a binge, his health would suffer. So if I got sick, he'd get sick. And I don't know the science behind this, but it just ties in exactly with what you've said about the way we are spiritually in ourselves. So much affects those around us, whether it's just mental or whether, like you say, there's something more. Gosh. And I I just add one thing here for anyone listening, just to, for anyone, for all those people listening, I mean, is that I still don't find it easy to keep my you know, to keep a clean house, or what's the word, you know, to run my partnership, or use what it's tough. You're literally only an illusionary thought away from going, I mean, I'm in a very unique position. I mean, I went on holiday snowboarding recently and just decided I'd have a drink, right? And I contained it to that holiday. I'm quite pleased that I just, on the final day, it's right, no drinking now. And yeah, I'm kind of pleased that I have demonstrated to those people that think that the AA model and this, you know, sitting in a room, purging yourself, you know, telling everyone your sins, and I don't see them as sins, I see them as experiences. I just wanted to demonstrate that, no, you can control your impulses. I'm not saying it's easy, and it's taken me a long time to get this far. Constant positive reinforcement of the positive thinking and the positive things in my life, and using positive strategies. But I'm just trying to be honest here, because I do get the AA thing. I do get the throwing your hands up and going, do you know what? I've just tried this bloody giving up so many times now, and I've failed so many times. And each time I do, it costs me more and more in terms of my relationships and my wealth. And I just wanted to state, I'm, you know, as far as I'm concerned, God, and I'm quite a strong, I mean, look at my achievements in life or my experiences. It's not like I can't go and bloody put my mind and do the things that I want to do, you know. But when it comes to the mental aspect and this thing, this learned pattern of behavior that's addiction, oh my God, it's so strong.
And that's the thing. Absolutely, Chris. And that's the thing which I always go at length to explain to people. And I think it's really, if you can take the guilt and the stigma away, it's really powerful, okay? And one of the ways I try and facilitate that, okay, is to explain physiology. And people don't do this. They don't do it with depression. They don't do it with anxiety. But if you have that structure about how your body is working, it starts making sense for people, and then they can take the next step. And what I mean by that is, when you're talking about that situation, there's a few things that are happening there. We've got this thing called neuroplasticity. It's a science that talks about how our brains are structured, okay? And we know a lot about this now. We're getting to learn more and more, but we wire in these behaviors, okay? So we're talking about muscle memory, et cetera, learning to play a musical instrument. The same thing happens with addictive behaviors, but that's just one part of it. So not only do we have to break this muscle memory, we also know that if you don't play your guitar for 20 years, that little synapse degrades a little bit, but you can get right back into it really quickly. We know this. This is also a component of relapse. But a second thing that happens is this response in the middle of your brain around an area called your amygdala. And you have very interesting neurochemicals firing off in there that you relate to reward responses. Okay? So one of the ways we have to address addiction is to have substitutes. So you could argue that this thing we talked about before, the whole connection, is a substitute for addiction. I disagree. I think that's another separate thing again. I think the kind of quantum physics type of paradigm we talked about, and the pheromonal and the human contact stuff is its own medicine of sorts. Okay, but then you have this purpose in life, whether it's your new child or whether it's preparing for that marathon, which gives you something else to put in place to meet that need for your amygdala working. And then finally, you have that chance to break that pattern of behavior. Yes, I go out every Friday night and I'll meet Jim down at the pub. I got something else I can do. And that slowly wears off. And it's interesting. I just want to say this for anybody who's listening to this, but the idea of heading off and going to skiing for a lot of people and having a drink in that situation is not the best idea, okay? Because that's what we call exposing yourself to a high risk situation. And unfortunately, the majority of people don't have that structure like you might have to keep those addictive urges at bay. So this, hey, I'm going to test myself and I'm going to have one and see how I go. That's a part of relapse. It's called exposing yourself to high risk situations.
I think this is my golden chalice? What's that? You know,
Holy Grail.
Holy Grail, you know.
I don't know.
This is the thing, the answer to this very conundrum is it's probably staring me in, I'm sure it's staring me in the face, but it's always my hand's there and it's always just that bit in front of me, right? And I'm fascinated and I just want to be completely honest about it, because the AA situation it's upset me as an individual, and you know, I don't want people calling me a drug. I mean, I don't give a shit what you call me, a wanker, a fucking idiot, a drug addict. On a person, I genuinely don't care. But from a societal perspective, I don't want it to be acceptable that we can call people addict. He's an alcoholic. She's a cancer. That one's got cancer. I think, and I'm throwing the cancer example in there to show how bloody unfair it is to call people by their disease. I've used the AA term, disease, but by their conditions. You'd never go up to someone and go, "You got cancer." "Oh, I didn't know you were a cancer." You'd promptly be beaten up by everybody, you know, in the room. And I'm trying to get it across to people. Don't use words like clean with. I know it's done in naivety. I get that, right?
But here's the thing, and again, you listen to Johan Hari. Love that guy. He just does such good work. And he said something in an interview recently, and it was really profound. I know a lot about addiction because I've worked in it, and this guy just threw this ball, and I thought, wow, this is really good. And he said we should have this assumption that drug use is normal. And I had to think about that, and he explained it a little bit, and I thought this guy's bang on. And when you think about it, you know your experiences that where you've been in those court situations and you're advocating for the client. You can't tell me that at least 60 or 70% of those people sitting in that courtroom did not have a recent drug experience. Whether it is, you know, going back, taking your wig off and hooking into the brandy, or whether it's, you know, seeing your call girl and having a cocaine binge on your yacht.
I've got a worse case scenario than that, Dennis. Coffee.
Well, there you go. Yeah.
Right.
Yeah.
My belief, or what I strongly feel, because I've kept myself alkaline now for 17 years. Wow. And I've never once been physically, as in like coughs, colds and flu, been sick in all that time. Before I started eating alkaline, I was sick all the time. Seriously, I'm not going to get into what I've done videos, friends, if you're watching, on the alkaline diet. It is the only, if I could only teach one thing that I've learned in my whole 50 years to someone who wanted to learn stuff, I'd say alkaline diet. Please take it on board. You know, you can't feed plants petrol, no matter if you think that makes you clever or the plant says it likes it. You can't do it. The plant will die. The human body is no different. There's certain things that nourish us. There's certain things that will make us die of some unpleasant disease quicker. But the what's the point I was making? I've just talked myself off my, no, yeah. So the example is, I feel that coffee as a height causes a lot of acid in the body, right? It was one of the things I tried to cut out the most. And so in drug terms, it's one of those hidden harms, isn't it? Because it's so easy to do. It's so easy available. It's so social. Come round, have a coffee. And there is almost zero focus put on the harm it must cause to the human body. It's a poisonous berry that grows in the jungle. That's essentially what a coffee bean is. It's a poisonous berry.
And ironically, again, just to touch back on another discussion that we had just before, the whole reason we are such dramatic coffee consumers is a result of the move from pastoral living. And this is why we had the wars over tea, and all these massive empires developed, because caffeine was introduced into society to have us having more energy for that 9-to-5 type situation.
And can I go?
The roots of it spring from the same.
Also, to give us that adrenaline rush, you know, that we would get if we lived in the nature. We'd probably get that 50 times a day by, you know, oh my God, there's a tiger. Oh no, it's all right, it's not. Oh, I've got to jump across this river. You know, all those little endorphin rushes.
Yeah, stimulations. Yeah.
So going back to my hidden harm example, is the people in this courtroom don't realize that if you have a cocaine addiction or a crack addiction, or my case, amphetamine addiction, that's going to probably take you 2 years to work out. You know, at the end of them 2 years, you're going to get so sick of having no money, so sick of having poor mental health, so sick of having poor physical health, so sick of all your friends and your loved ones thinking you're a freaking loser and not wanting to have anything to deal with you, so sick of having to shoplift for your food or steal, you know, or sell drugs, do all these things that the little angel, the good angel on your shoulder saying you shouldn't be doing that, you shouldn't, you know, when she's talked to you like that for 2 years, you finally go, do you know what? Yeah, I think I actually need to do this stages of change thing, right? And so you have 2 years of being a bad boy, bad girl, and then you start sorting your life out, right? Show me where a coffee drinker has that moment of change, that moment of clarity where they go, do you know what? This is actually a toxin. This is actually a berry that's designed to tell mammals, don't eat me or I will make you feel very, very strange. And yet typical man, what do? We commoditize it and we, you know, whatever the, you know, domesticize it or whatever the word is, bring it into the home, realize if that we take that poison in a certain quantity, which is 1 spoon of sugar or 1 filter, that it doesn't quite poison us to the level where we're never going to eat that again. But what it does do is give us a little buzz. Exactly the same with rotten apples, you know, cider, rotten, you know, wheat or whatever, hops or whatever it is you make beer. You know, we've done it to this line. And so what I'm saying is, you know, if you want to take action on drugs in society, they're dangerous. Look at coffee. Definitely look at alcohol, which in my experience is the worst of all. And what about your McDonald's? You know, how many people are going to die younger, because they're shoving that trash in their mouth, right? Does anyone ever go up and, do you know what I mean, and start hammering on their door going, you're a McDonald's user, you use McDonald's, you know?
Chris, you're knocking it out of the park, mate. You're making so many brilliant points, you know, and I don't know which one to address. There's so many excellent observations that you made, but a really good one that I reflected as you were talking. And it's part of, I think, helping people with addiction sometimes is trying to regain that cohesiveness in a family, okay? And I had a lot of situations in my work where you've got one person marginalized, whether it's a son or a daughter, a sister, brother, husband, whatever it is, and the other person is just at their wit's end and they just can't understand. But the best one is when the other person walks in with their packet of cigarettes, because then, and it's a beautiful thing. It's not to criticize the other person or make them feel bad, but it's just to set up some empathy with the other person. And when you have the other, so you've got the person who the focus of attention is on, the person with the addiction problem, and you have their support person who's just looking at them in disgust because they're dirty, as we use that word. And you try and talk about the hurdles of addiction, and you kind of can see the support person who's just over it, they're not interested. And then you say, okay, as a really great way to support this person who you've come with in relation to addiction is to have role modeling behavior. And they look at it and they go, what does that mean? Okay, if you think they should just drop everything because it's destroying their life and your life, why don't you try and go on a journey with them and give up smoking? Mm-hmm. And that's a bomb when that hits the floor, okay? And then you can develop that to explore a little bit more empathy for the support person. Well, if you can do that, then you have every right to say this is easy for the person that you're here to help. But if you can't, you have to understand what we're dealing with here, something that's very, very tough to deal with. And your examples of coffee and McDonald's and Coca-Cola, they're perfect examples.
Yeah. Funny, people used to tell me I think too much. Used to really upset. I'm not going to give names, but certain people I'm thinking of, you know, they used to say, Chris, you think too much. You think. My answer was, well, I'm dying. I'm addicted to drugs. I've got to think, because no one else is going to fix this for me, right? But it just makes me laugh that, God, we are deep thinkers, aren't we? Probably not deep enough, but
yeah. Listen, who knows? But I think this is the thing, you know, like, and I've kind of, you know, I've met yourself obviously through LinkedIn, and so I'm doing a lot of work on LinkedIn and put a lot of messages up and stuff. And it's, you know, I kind of, you know, you get asked some questions and you deal with people and you kind of reflect on why you're doing it. And I think this idea of this is promoting awareness. This is how, you know, there's people who I hope will have a look at what we're talking about. But if we're not talking about this, it stays shut in. But when we're talking about this, it can hopefully liberate a few people, and they can identify it, and they can empathize, and they can know that these issues are around, and they can maybe put their hand up. This is why we're doing it.
Yes, exactly. Dennis, it's been absolutely I'll say that again. Dennis, it's been absolutely enlightening to speak to you. Thank you so much, just for your kindness, your humanity, your knowledge, and for sharing it with all of us, especially, you know, our listeners out there. Let's finish on our traditional, and I should say, I'm sure this is going to be the first of many chats that we're going to have and be able to put on YouTube, because there's so many areas to talk about. If anyone watching has got a question for either of us, please put it below. We'll either cover it in another video or in a comment. We're called the Bought the T-Shirt podcast. Do you have a T-shirt for us? Something of relevance.
Well, I guess, Chris, you know, even though I'm technically Australian, you've identified quite correctly that I don't quite sound Australian. And as you might guess, I still have some links back to the old country. So periodically I do collect some stuff. And one of my last things that I picked up, actually it was given to me as a gift, is quite
There it is. I had a feeling that was coming out. And I think I said to you earlier that they call it the ruin of the people in the know call it the ruin of Ireland, but
it's ruined a few of my mornings after I've woken up after St. Patrick's Day as well, I must say.
It's quite funny. It relates a lot to what we're saying, though. Can somebody else ruin you? Can someone else lead you astray? Or is it all within you and what's in here? I'm guess like everything in life, it's a combination of both, isn't it? You know?
Absolutely.
There's no one single answer. Isn't it funny, though, how in our very archaic human way of thinking, Guinness is looked at as a health drink. You know, this is the good beer because it's got vitamins. Whereas it will just as likely end you up homeless in the gutter as any other form of alcohol.
I must correct you there. All alcohol except Guinness is bad.
Okay. I'm going to craving for Guinness now. I tell you what I had in Dublin the first time I visited Dublin is I had oyster beer. Have you come across that?
I don't think I ever have. No.
There's a very famous ye olde ancient pub in Dublin. Yeah. I won't pretend I remember the name of it, but it's a very plush, elegant place. Everybody heads there if you're a tourist. One of the things they have is an oyster flavored Guinness. Wow. And if you're a seafood lover like I am, I don't eat a lot of it because seafood actually is very acidic in compared to other forms of meat. That's another aside to add to all of our asides today. But yeah, it's a really nice drink. Oyster flavored Guinness. Yeah, nice. And I always ask people if you have a recommendation or possibly an inspirational book, film, and person. So let's go for book.
Where do you start?
Just one, because we'll be here all day otherwise.
Gee, you got me on the hop. To be honest with you, inspirational book. There's so many, it's hard to choose. But one of the ones
I'm just as interested in one you might have just enjoyed. I mean, I'll tell you, for me, I loved Kon-Tiki expedition. I wished I was on that expedition. Oh my God. There's another one called Adrift by Stephen Callahan, 76 Days in a Life Raft. These are books where I could easily read it beginning to end, no problem. No, there's no boredom factor in it. Then I could start it again and just read it again. Do you know those kind of books?
Yeah, you just sparked my memory, so that's really good. But again, I as you might have gathered, I do like a little bit of science stuff every so often. There's an English writer, his name is Peter F. Hamilton, and he writes these massive sci-fi futuristic space opera books, and any one of those, I've read some of his books about 2 or 3 times, and any one of them I'm a huge fan. Paints a very interesting future, and I wouldn't be surprised with some of the stuff that he mentions in that, about technology in our skins and all that kind of stuff. It could come to fruition.
And a film?
There's 2 that stand out. The Matrix, for probably reasons that I'm sure you're aware of, living in a false reality. So that's the documentary I'd be mentioning, and then we can talk about fiction, and fiction would have to be Snatch.
Snatch, brilliant. Did he have a good Irish accent in that, do you think, the Brad Pitt? It was Brad Pitt, wasn't it?
It was Brad Pitt pretending to be a gypsy, yeah. And fantastic. I couldn't understand him, so it was great.
It was, yeah. You could imagine him selling, was it the ponies they have, isn't it? The wild ponies that they sell.
Ponies and the dogs and the caravans, yep.
Yeah. It's very rich culture in Ireland. It's so much... Yeah, just so much history and authenticity, authenticity. And so what we're coming on to, a person.
a person, again, I think one of the guys that's got to be up there is the fellow I mentioned before, Peter Breggin. Another guy, Robert Lustig, he's the guy who did that documentary, the Sugar to Bitter Truth, or the talk Sugar to Bitter Truth. And these guys basically are very well qualified professionals. They're both doctors, they're in the medical industry. And these guys, you've had careers that have been crucified for standing against dogma with good science. And both these guys stood up in the face of all these odds, telling truth. And the way they did in this, I just encourage anybody to look at some of their stuff, especially Breggin, the way he dismantled some of the most obscene medical practices we've ever done. And he did this just about single-handedly. But yeah, Dr. Peter Breggin would have to be up there.
Well, the Gurkhas, their motto is something along the lines of, it's better to live like a lion than die like a cat. No, it's better to die like a lion than live like a coward. So it's something along those lines, right? I've probably got it completely wrong, but that is almost so true, because a lot of the stuff I speak about, it's quite lonely being on that parapet. Parapet isn't the right word. Podium.
Yeah.
It's you are quite alone, and you're talking about very controversial stuff. And you, to a degree, I guess, if you had a big enough platform, I'm talking about the likes of the Joe Rogan kind of type people now, it does make you wonder how much you could be outspoken, or what they call outspoken, before someone puts a bullet in your head, or you end up in one of these accidents like where you shoot yourself in the chest but also throw yourself off a bridge at the same time, and you manage to suffocate yourself. What do they call it? Being suicided.
Yes. Yeah. Or you have very inconsistent strangulation injuries that can never happen from a sheet when you're in your prison cell being investigated for pedophilia.
Yeah.
I don't know what I'm referring to there.
Yeah. Oh my God. Yeah. There's a hashtag about that, isn't it? Is it Epstein?
Yeah.
Didn't kill himself. I didn't actually
want
to say his name, because that will probably get this video demonetized now, but hey ho. Yeah, I think it's easy. Just get out there, speak your truth in life, and you're going to get haters and detractors, and it might even be the death of you. But that's better than being a coward. That's what I think. I know when I'm being a coward, and it's not a nice feeling. Yeah. So people can reach you through LinkedIn, Dennis. I'll put your link below. Any other links that you want people to be aware of, just message me and I'll put them. So any other social media, and let's pick this up again. Yeah.
Perfect. Love to do it, Chris.
Thank you so much for making contact. Brilliant. I've got so much out today. I think we could talk for 12 hours non-stop.
I think so.
Then we just have a quick break, and then we could do another 12 hours. You're fascinating man. Thank you. To all our viewers, listeners, subs, whatever we're calling it today, massive love to you and your families, big respect, and see you all soon. Friend, thank you for watching my video. I'm the only person I know that has ticked every item off my bucket list, and I did so coming back from chronic addiction with no help from anybody. Now I want to pass those skills on to you, but I can't help you unless you help me and hit the subscribe button. So please do so, and let's go and smash this world together.